an epidemic, but the rates are still extremely low. And of those rates, majority of the detransitioners are due to social pressures, finances, like medical risks, or their peers. It's not because they weren't trans, and it's usually temporary. But yeah, they don't care about that part. They dismiss that part because whenever the facts aren't on their side, guess what they say? One is enough. One is enough. Like, come on. If you're gonna live in the real world, one is really never enough when it comes to policy. You might be able to find like certain instances in which one can be an inspiration for it, but you take risk with every policy. There's going to be positive and negatives that happen to certain people. But yeah.
Yeah, hello.
Hello, what topic do you want to discuss?
Trans kids don't exist.
What's your thoughts on it?
It's a load of bollocks, mate.
Why is it bullocks? No! Damn it!
Because it's just...
Damn it, hold on. Fuck.
What?
Spilled the drink.
Yeah, but being trans isn't true. It's just a bunch of people seeking attention and not being normal, trying to be weird.
Who do you think you're talking to right now? I said I spilled the drink.
What?
Just wondering. Damn. Wait till I'm gonna have to get a towel. Oh, here's one. Hold on. No patience whatsoever. Yeah, I'm not gonna stop cleaning up a mess to debate you. Sorry. Hey y'all, welcome in. Tap the screen, share the live, get more people in here. Also, I think it's very hilarious. I've made the comparison in jest a lot of the times, but it really is like a genuine thing that I feel to where people will hold these two beliefs in tandem. Kids cannot understand who they are or anything about their internal identity, but they can understand that a man died on the cross and created the entire universe in 7 days. Right? Right. I feel like it's just like the contradiction of complex thought and what internal feelings can be had versus what understanding they can have. And like kids understand a lot more than we give credit for. But like, you gotta be realistic and you gotta apply that standard equally, not just wherever it's most politically convenient for you. Like, come on. Damn, I got all over the floor. Almost done, almost done. Damn, I really try to catch it too. Alright, that's good enough. Let me just wash my hands. Alright, I'm back. Damn. Hey, how are you?
I'm good, bro.
What's your thoughts on the background and what topic do you want to discuss?
I guess the first three, bro. Oh no, the first two.
Pick one.
I guess trans kids or gay kids. Bro, I thought kids, they don't have gender or they don't have sexualities, bro.
Can you speak up a little bit? You cut off towards the end.
Kids, do they have gender, bro?
What?
Kids, do they have gender?
Do kids have gender?
Yeah, or was it just given to them, bro?
Gender exists in society and people can understand how they fit into the concept of gender growing up and understanding themselves, right?
Yeah. But I don't know. I feel like gender is a thing that kind of changes. Like you can change through the what's it called, their life. So, I mean, like when you
Gender
say trans,
changes
like,
through your life?
huh? What?
Gender changes through your life?
It could, yeah. Well, it potentially could.
I don't believe so. I think that gender is something that is more
Or it's something that you perform.
predisposed, like sexuality, which is why I bring the comparison.
So people have like a biological thing in their head that tells them what gender they are.
I mean, you can say biological, neurological. I think it's predisposed. I think it's ingrained into who we are as people, which is why, despite people's efforts to convince us to be straight, to convince us to be cis, or to convince them to be cis, it doesn't work. And they just have more mental strain and a lower quality of life.
I don't know. I think you just have to let kids figure it out, no?
You have to what?
Just let kids figure it out.
Let kids be on their own?
No, let kids figure it out.
Okay, but the whole thing is if you paint a specific narrative that excludes any information to allow them to understand what those feelings are, they can't do it on their own. The only reason you can do it on your own is because your feelings towards the opposite sex is already affirmed by society, and you grew up where it was socialized and normal for this behavior to exist. Do you think it would be easier or harder to understand heterosexuality if there was limited mention of heterosexuality as a child and you had little to no examples of seeing heterosexual people in your surrounding?
So what should the alternative be?
Okay, I'm not going to get an answer for that question, but the alternative should be equal education and representation of people that typically are not shown in public eye. Representation matters.
Oh, yeah. Well, that's it.
It does. I think historically, sociologically, and in media, there's so much evidence to support that it does.
Well, so they grow up like being influenced, or you think what does representation do then?
Is my volume
it lets
down, or are
people-
you muttering? Okay, it was down a bit. Continue.
So what? So more representation. Like what does that really do for people?
Okay, I just feel like I don't know what world people who have this opinion live in, because I was exposed to so many stories of people being like, well, I'm a little kid and I don't see anybody who looks like me on TV. I don't see anybody who acts like me on TV, and they have deep-rooted insecurity about that or lack of self-confidence because of that, and it affects their mental state growing up and how they fit into society and leads to further ostracization. I don't understand how somebody can have that perspective when we understand how hard people had to fight to get into these media roles, to get their history talked about in school, to have this representation. I don't. It's like
history
to get on the public appearances and have these like concerts, to have any kind of like actual credit for their work either, because a lot of times when they didn't have representation, people just stole credit and nobody gave a shit. Like it has significant impact on our history. You're, I don't know, bro. Doesn't really agree with history. You can read about it and you can learn about it.
I'm not saying I disagree, bro. I'm not saying I disagree. I'm just thinking, innit? Yeah, but is it just representation?
I'm bored. Do you have another argument?
Is it just representation that's important, or?
No, I gave 3 examples. You only latched on to representation because you thought it was the weakest. I gave the example of education, representation, in the media,
positions of power,
like other forms. And what was the third one? Just like equal treatment is like what I believe. I think representation and like promotion of equal treatment is very good for society.
It seems like the bare minimum, bro.
Is it the bare minimum? Because why are people arguing against the bare minimum when it comes to any representation of LGBTQ people in education? People arguing against CRT or education about certain historical aspects like
CRT?
slavery. Like, do you not see the erasure here?
Yeah.
What about the way in which we stole like pretty much all of our celebrations and like holidays from pagan holidays and gave no credit whatsoever and still demonize witches in today's society as being satanic and of the devil? I just don't understand how people can have these beliefs and not understand that we've erased a lot of the roots of them for a reason. I was raised in an American educational system believing that George Washington's teeth were wooden and that they had a set of wooden teeth in a museum to show that George Washington's teeth were wooden. They were slave teeth.
Oh, that's worse, bro.
Yeah. So maybe accurate history is also a form of representation.
So what, like trans people existed forever then?
We didn't have the language to understand the concept, but the concept existed, and people with gender dysphoria, people that were trans existed. Yes. Just like you might have the language to understand like gay people in the past. Like people didn't have like, it was considered like a mental disorder. You didn't understand what caused it. You didn't understand like any societal implications of it. So a lot of like falsified medical information came out about them to demonize them and also argue to make their existence like illegal and any expression of it illegal, which it still is in many countries.
Isn't that just like white history though still?
Isn't that just what?
White history.
I gave you many examples of Black history. I don't know why you're ignoring them.
No. I mean, like specifically, like you say.
You're saying this specific example I'm bringing up is about white history?
Huh?
You're saying this specific example I'm bringing up about queer history is just white history?
Specifically about it being considered a mental disorder, kind of. Yeah, no.
No, I'm pretty sure they didn't put a race to which gay person was demonic or mentally ill. I'm pretty sure it was everybody who was gay.
No, I'm talking about the whole world. I'm not talking about America. I'm not from America, so I'm not just talking about America. I'm talking about like, the whole world history.
The whole world is straight? What?
Like global history, like world history, basically.
Can you speak up a bit? I can't hear you.
World history, bro.
World history, yes. Homosexuality was demonized in a lot of world history, not just American history. And it wasn't just for a specific race.
Yeah, but some places it wasn't demonized now. So why don't we teach that?
Maybe not demonized as much. People definitely had opinions about what the natural order was. And might be plenty of examples you can find where it wasn't demonized, but like there's plenty of discrimination in history. So like, I'm not saying one is better than the other. I don't know what argument you're trying to make here, that it's not demonized everywhere in the world, so I shouldn't care, or representation doesn't matter. I don't know what point you're trying to make with that.
No, I'm saying representation matters, but like I'm saying there's good history as well now to show people.
Yes, you should. What's your point? State your point, please.
Yeah, show the good side of the good side of the history, innit?
The good side of history in which some places didn't kill you for being gay or put you in prison. Like, okay, chattel slavery wasn't everywhere. Is that a pro for you, or do you think it's just like the bare minimum that we were talking about?
I don't know. Seems like you could be doing more now.
We didn't imprison you, baby. Yay! Thank us. Like, that's what it sounds like to me. Sorry, that's not good history to me. That's neutral.
No, I'm saying like, actual stories, bro, of like historical figures and stuff like that, like to make people proud of being queer or whatever, bro.
Pride out of being queer only comes from pride of overcoming discrimination for being queer. It's not, well, congrats, I fuck guys. That's a fact that should be celebrated. No, it's the fact that our existence was demonized because of who we loved, and that was overcame. And we're fighting against current stigma that still wants to demonize it. That's where the celebration comes from, which is why it's weird as fuck when white people celebrate being white. Because what the fuck did you do to earn that? Or like straight pride? What the fuck did you do to earn that? You've always had societal acceptance and like everything was already in your honor. Why do you need another thing in your honor just to try to take away from somebody else's pride?
It's like a performance now.
What's a performance?
Straight pride.
Yes, it is very much a performance. And it's pretty much like an all lives matter movement to gay pride. It's just saying, I'm going to have a movement to take away or devalue your movement because I think your movement is invalid in the first place. I think it's a very stupid movement.
All right, good talk. There's someone else that wants to join, so goodbye, bro.
Because you have no arguments. My God, what a waste. What a waste. Adult man talking about kids. It's so funny the narratives y'all are desperate to spin. Like, just argue against what I'm arguing. No, I'm not doing a 2v1 just because you want help. Josh, you requested first. You both have questions and you can ask them one at a time. Hi, how are you?
Hello. I'm good, thanks. And you?
Good. How old are you for TikTok guidelines?
I'm 24.
All right, what's your thoughts on the background and what topic do you want to discuss?
I mean, I think you can identify as trans, but whether you are actually trans or, born in the wrong body, so to say, I don't think is a real phenomenon.
Okay, thank you for... are you saying you don't believe trans people exist?
I recognize that they exist and identify as trans. However, I don't think that the phenomenon of being born in the wrong body is...
Okay, but then
a
your
real
argument
phenomenon.
isn't, I don't believe trans kids exist. Your argument is, I don't believe trans people as a whole are valid. That's a different argument. And not what I'm arguing here.
Okay, well, it goes both ways. I don't believe trans kids exist in that way.
I mean, sure, I think it's a complete disregard for the point of the topic, but go off.
Okay. Well, I don't think there's enough science to say that someone can be born in the wrong body. So for someone to identify as trans...
So you're
especially a
automatically
child-
assuming the negative, even though there hasn't been enough evidence in your eyes to support the positive. You're just assuming a negative?
No, so usually in that case, we go for the null, which is no difference. That's what I'm doing. We don't claim to be something that there is no evidence for.
Well, there's clearly a shared experience that through therapy and a lot of similar results from certain treatments that you have very consistent and reliable results of when it comes to better quality of life, lessening like dysphoria when it comes to like self-perception or perception of yourself in society. I feel like there's plenty of evidence it's not just null because there's no evidence. There's just evidence you don't consider compelling enough or willing to accept. Or even if there's evidence in the favor of it, you just don't think it's proving the thing that is proving.
I think there's no evidence. I recognize that treatment helps people, but that doesn't really paint the full picture. That doesn't give us what the problem is exactly. That just tells us how we relieve it. And that's not necessarily the same thing.
Do you not think the consistent experience of like gender dysphoria or like this specific dysphoria when it comes to your gender expression in society being incongruent, do you think that lends no credibility to the claim of trans people having this feeling of being born in the wrong body?
I mean, it can, but it's the same thing as saying, why don't we affirm schizophrenic people because they all hear voices in their head?
No, because the whole point is that the treatment for schizophrenia is not to affirm their delusions, right?
Right, yeah. So the delusions aren't real.
So then if the treatment is different, then maybe you should treat it differently or see it differently, right? Because you want to cure schizophrenia, you're not curing transness, you're curing the dysphoria that can come with being trans. You're misrepresenting how that mental disorder is diagnosed.
Well, not necessarily. Like, I recognize treatment helps, but it's not the same as saying that scientifically someone can be born in the wrong body.
Okay, but I'm not going to let you skate past that. The whole point of your comparison was to draw a line saying being trans is comparable to being schizophrenic. And I said that's not
teaching
comparable.
That ideology.
That was the analogy.
Is comparable to affirming schizophrenia. Teaching that ideology is comparable to affirming schizophrenia.
Teaching what ideology?
The trans ideology.
The only reason you consider it comparable to schizophrenia is because you personally don't believe in it.
No,
That's the
there's
only
just no
reason.
proof for it.
If anybody applied that same logic to any political position you hold, you call it ridiculous because, well, no, I believe it to be true, and I believe there's enough evidence to support that it's true. That's not the same thing you do.
Right, but I don't
when you're
take
arguing against
beliefs as
schizophrenia.
evidence. Right, so
You just
unless you
don't
can
believe
prove
or accept
No,
the
it's-
evidence. You just don't believe or accept the evidence. You're trying to paint it as it's all wishy-washy. It's all nothing. It's all fiction. No, there's evidence there that you don't find convincing.
that you can be born in the wrong body.
Yeah, that you have a different gender perception internally than is expressed in your sex.
I recognize that they feel different, but I mean, schizophrenic people also hear voices.
Well, you keep trying to make this
difference, really.
comparison. Do I need to explain why it's different again, or do you understand why it's different?
You might have to, unless you can provide some proof that you can be born in the wrong body.
Well, I was
that
talking
there is
specifically about the
something inherently
treatment, and I was
going on
saying
there.
that the whole point you're trying to make comparison to is that being trans in itself is a mental illness, which it's not. Not in the DSM-5, not under any definition.
Gender
that I've
dysphoria
made.
is.
Gender dysphoria is not being trans. Cis people can have gender dysphoria. You know that,
Didn't
right?
you say the treatment is to relieve dysphoria?
The treatment
So
is
you'd sort of-
affirmation of their gender.
Right, to relieve dysphoria.
Yeah. So for a trans woman, it would be gender affirmation of being a woman, not being a man. If the whole thing was treating the delusion, then you would be treating the delusion by treating them like a man, but that doesn't work. It worsens the dysphoria, and it worsens the self-mental harm that comes with that lack of dysphoria. Like there's plenty of harm that comes from that. So if
Right,
it
but you
was
just sort of
really
agreed with that.
comparable to schizophrenia, then the treatment should be ignoring the dysphoria in itself by treating the opposite, by saying, well, I'm not going to affirm it, I'm going to disaffirm it, by saying it's false. But in everything we've seen, every study that we've seen, that literally just causes more harm.
No, I recognize that, but I mean, you've
So
just said
can you
yourself
stop
that
drawing the comparison?
the treatment is to affirm the gender dysphoria, to alleviate the gender dysphoria. So, I mean, what are we alleviating if
You're
there's
not
no
affirming the gender
dysphoria or mental illness?
dysphoria. It's affirmation of their gender identity, not the dysphoria.
Which alleviates what?
Alleviates the dysphoria. That's the whole point.
Okay, so it
Gender
alleviates
affirmation
their mental
alleviates
illness.
Dysphoria.
Yes. So, in other words, alleviates a mental illness.
The dysphoria is the mental illness, yes. Just like
Yes,
anxiety. The whole point is to follow the treatment plan. Why do you not, let me ask you this. Why do you not want trans people to follow the treatment plan for gender dysphoria?
I think when it comes to kids, some of those medications can cause irreversible effects, and it's not safe. I don't.
Okay, what
think
about
there's enough
adults?
research into that. Adults, you can do what you want as long as you're.
Do you think it's
adult,
beneficiary?
Yeah, I think it can help people, sure, but I don't think that it's necessary for a child to take those medications.
What medication specifically? Are you just talking about hormones? Or are you talking about puberty blockers? Or are you talking
HRT.
about- Okay, so what risks do you think cannot be understood about that when it comes to
Right, so we don't have
HRT at
any
younger ages?
evidence of the long-term neurodevelopmental effects.
Well, we
Also,
know the
it can-
positives,
we
right?
know that it can
Positives-
affect bone mineral density. It can cause you to become infertile.
Mhm.
It's sort of a big risk for a child to be taking, right?
Yeah, I would say that the risk is still pretty minimal with those things, but yes, those are risks that you can consent to.
A child?
And as long as it's informed consent with the parents involved, then yeah, I don't see why they can't understand that. And by the way, do you understand the positives of taking that medication? Because if you're going to talk about the positives and the negatives, that's being weighed by the parents, child, and doctor. You should also understand the positives. What are the positives?
Right, yeah, you could have a better outcome overall. However, I think you should
What's
still
that
wait 5
outcome?
years. Better quality of life, better,
Through what
lower
means?
suicide rates. What do you mean?
A smoother transition,
Yeah, sure.
more optimal results, as in a lot of help in reducing a lot of that body dysmorphia that comes with gender dysphoria. Right?
Right, but you're also potentially harming kids who may change their mind later.
Okay, if you're going to talk about we're harming kids in the stuff that happens later, you should also look at the rates in which it does that harm. The overwhelming majority of these cases are helpful, not harmful. Because most people who are going through the therapy, going through this informed consent with their parents about making this decision, about going on HRT, they know what they want. They know who they are because they've gone through this therapy in this
child?
waiting period. Yeah, that's
Like
why the
you're saying like a
detransition rate.
15-year-old knows what they
That's why.
want at
Hold on.
15?
When you get to the hormones, the detransition rate is extremely low. That's why.
Do you understand you can't really back out of it once you're in there? Like it's sort of becomes a permanent thing after some time.
Well, after you stop taking puberty blockers specifically, like you have a normal, a pretty typical, what's it called, puberty. But like when it comes to like hormones or anything, yeah, there's going to be effects that can be mitigated.
But you're also just changing the hormone balance in their body. So of course they're not going to want to, suddenly change back to how they were because the chemicals in their brain work differently.
Hormonal imbalances.
Yeah, but no, not if you're trying to transition them. That's the whole point, is to stop some of those hormones.
Yeah, during you're talking about puberty blockers, puberty. It's to stop the hormones that are releasing during puberty, so it's delaying when those hormones are released. You can still have like the evidence is saying that it's pretty much a typical puberty once you stop taking puberty blockers. And the whole point is to give them time to whether they want to go on HRT to get these hormones to have a smoother transition. I feel like you are kind of conflating HRT and puberty blockers.
No, I get the difference between the two, but also 98% of people or transgender youth who will take puberty blockers will go on to take HRT.
Because they know who they are. Only furthering my point that you're just assuming that all these people.
I don't think you can make that claim. I don't think you can make that claim for a child. I think it's more that they are now behind in their puberty. They are behind relative to all the people their age, to say that it's because they know who they are.
Great. Can you not trust the statistics of people who detransition being extremely low as evidence for that claim rather than just taking their word for it?
No, I'm not going to trust your statistic because it's sort of misleading in a way. It's not the full picture.
How is detransition rate something that the right uses all the time to try to like invalidate trans people's existence? How is that like not?
Because why are they detransitioning? If you've messed with the chemicals in someone's brain, it might just be easier to persist.
I hate to break it to you, but when you ask why they're detransitioning, I hate to break it to you. When you ask why they're detransitioning, that only further proves my point. Because of the people that detransition, what is it, 50% do it for reasons like lack of financial support, like bullying or harassment from their peers or family, or like discrimination they face in society. Like a lot of it is because of those reasons or from medical complications.
Yeah. But you don't realize that people who potentially may have wanted to detransition are like far too deep. So it's like, what's the point after you get, say a few years in, your hormones are messed with, there's no going back. If you're starting HRT at say the age of 16, there's often not much chance of going back. So you might as well just persist with it.
After hormones or after puberty blockers?
HRT can start at 15, 16, sometimes 14.
Yeah, I don't see any evidence of that there's no going back. What specifically is not going back? Are you saying the hormonal imbalance that you can correct? What specifically about it? I feel like you're talking out your ass here.
No, I'm just saying that there's no evidence for it. That's what I'm saying. It's like, you can't say that they're sure of their identity because you don't know that. But it's going to be hard for them to transition back.
Both reversible and irreversible effects. Reversible changes like skin texture, fat distribution, body odor often revert after stopping, but permanent changes like voice deepening, breast growth, facial, body hair, clitoral enlargement generally won't reverse. So fertility loss and other long-term impacts are possible, requiring careful consideration before starting. Yeah. I think those are things that people can consider the risks of when they're after going through puberty blockers for years and having that time to self-discover and understand who they are, and also having that therapy to guide that self-discovery. I don't understand why you think that you just know better than them. Take this like smoother transition that helps their mental health statistically away from everybody because a few people, like legitimately, the statistics are so low on people who regret this. Actually,
Right. So do you think a
once it gets
child
to the
really
point of
can
HRT or
conceptualize that
anything like
risk?
that.
Do you think a child can really conceptualize that risk?
That's why they're working with their parents and doctors to make that decision, and it's not just the child's decision.
Right. And is that always like the best decision? Do doctors always make the best decision?
Do parents always make the best decision?
No, absolutely not.
No. So you can have a level of trust in these processes. Like you do when you're
Right, but
bringing your
it's-
kids in to get a vaccine. Like when you're bringing your kids in to get other treatments.
Right.
So you have a level
But-
of trust, and you can make that decision together based on the best information that's currently available. But you don't want them to have that choice to make that decision.
Not when they're a child, no, because it can be permanent. There's not enough evidence to suggest that it is really the cause. It is worth treating. You know, if
You
it's
don't know
really
the
about their
cause,
mental
though.
health,
You're
if it's
assuming
really
the
about their
cause.
mental
I'm
health,
saying I have evidence based on the low rate of detransition, the rate of affirmation affecting like gender dysphoria reducing, and the palpable things that we can see in society that benefit trans youth becoming adults and knowing who they are overwhelmingly. Like overwhelmingly, statistics show that they know who they are at younger ages. That's what they're saying. That's what the statistics represent. And then there's you saying, well, maybe they don't. And it's like you're asking me to take your argument with so much more credence with like no facts behind it compared to mine. And I just
But
don't see why that's
sort of like
reasonable.
it's sort of like saying if I'm stressed, if I'm having trouble with my mental health, I should just pick up smoking because clearly we know that does reduce stress. We know that reduces anxiety,
Great. Do you
right?
think
But there are long-term
smoking,
effects.
do you think smoking cigarettes is comparable to taking HRT?
I just bring that up because we don't know the long-term effects of HRT fully, especially
Do we know the long-term
neurodevelopmental.
effects of
Right? And we
smoking?
know that it is permanent.
Do we know the
We do,
long-term
yeah.
effects of smoking? So why
So
are you
it's a
bringing up
similar
a
situation.
comparison?
It's a similar situation where those long-term risks can surface later on.
I'm sorry, you just
We're
have to,
prescribing
you have to
something
take
that we
the
don't
L there.
fully
That was
know
a
the risk
horrible
of.
comparison.
No, we're prescribing something that we don't fully know the risk of.
Okay, we didn't fully know the risk of the vaccine that came out when it came to COVID, but people can still understand the risk
and
and take
did
it
we
because you
just give
don't.
that to kids?
Huh?
No, I think there was restrictions on who could get that, and I'm pretty sure under 18s for the most part in most countries could not get that so easy until there was sufficient research.
Well, I have to see what specific things and what reasons for that, because that could just because of increased medical risk.
No, because children are developing. There is an increased risk on children because it messes with their development, right? And it's WPATH, standards of care. They mention it themselves. There's not enough long-term risk measured. So we don't know fully what the effects are. So why are we prescribing this to children?
Well, we understand what we understand, and we think that people can understand. Like people have been taking it for a long time when it comes to HRT. Like,
But that's not compelling, right? Say 50 years ago, we understood what we understood about smoking. We know that it was good for stress, good for anxiety. Oh, now what? Causes cancer. You see how that can sort of just backfire? We need more research.
okay, but I hate this argument because it's in such bad faith. There will never be enough research for you.
No,
Are you going to
that's-
say
that's
that
not
there's
true.
no? Are you going to say that there's no? If there was no risk to HRT, if there was no risk to puberty blockers, you would allow 14-year-olds to take both?
Sure, if there was confirmed no
you're
risk.
lying. You're lying.
You're just making assumptions now because you don't agree with me.
No, I think you're lying. I think
You-
most
you call
people
me bad faith.
actually make the argument that you do not know who you are at that age, and that's why you shouldn't be taking it, not because of these risks that can be minimized.
Well, it's both,
I just
yeah.
don't understand it.
For a child, right? Do you really think that they can consent? They can't. They don't know who they
aren't
are.
the one making the consent decision by themselves.
so
It's
for a
with the
doctor-
parents and the doctors, which you do
For a
every
doctor-
time you go into the doctor's office with your kid.
Right. So for a doctor to prescribe this medication to a child, they need to know the risks. And they don't.
Okay. Do you know every risk of every medication that you've taken? Have
No,
you taken
no.
ibuprofen as a child? Have you taken like other medication as a child at all? Because like,
Of course,
there's risk
not
in all
persistently.
medications. You know this.
Of course. But not persistently, right? If you're taking a medication persistently over years, right? HRT is something that you'll probably take for the rest of your life. You really think that that's comparable to ibuprofen?
No, but we can we
Exactly.
can also determine long-term risks of like other medications. But like there is a lot of studies on HRT. It's just like the long-term studies are hard, and they clearly don't want any funding to go to them. They literally are trying to
Right. So,
restrict any
where are
kind
the
of funding towards
long-term
them. So if you actually
studies
want to
on
understand these
children?
risks, you should want more funding in towards like transition studies.
So where are the long-term studies on children?
With what? HRT?
Yes.
What's the longest study we have? 10 years, I think.
I mean, like I said, WPATH standards of care have mentioned it themselves. There's not enough research into the long-term neurodevelopmental effects. So when you're giving this to a child who is still developing, that's sort of a problem, a big ethical problem.
Hold on. Let me see. Okay. In these KEEPS continuation analysis, there were no long-term cognitive effects of short-term exposure to MHT. No, I don't think that's right. That's different. I'm trying to find HRT. A lot of this is specifically for menopausal women too.
Exactly.
So a lot.
And I don't think kids are the same as menopausal women.
Yeah, duh. Thanks. So a lot of these studies are more centered around women with menopause, which is a lot of the results I'm seeing.
So we have no studies on children.
None? You're gonna make that claim?
No, I'm not saying none as in zero.
I mean, you were.
Come on, no, you can put the pieces together. You're just going to point out anything I say now to get one up.
Well, yeah, if you're making 100% statements, I'm gonna clock it as bad faith. Duh.
No, I think it's, you know what I mean. I think you're being bad faith here.
How was I being bad faith? I'm literally saying none, as in because don't say none.
Right, but you've heard me before saying there's very little evidence on kids, especially long term. So when I say none, I'm just saying that there's...
When you say none, it's for a reason.
Shit all, basically. No, that's just sort of how language works. You don't need to be precise with everything you say.
For over a decade, with them reaching up to 15, 16 years of follow-up. Examining hormone levels. Key findings show that GAHT... What's GHT? I don't know. Gender-affirming hormone therapies, GAHT, generally improves mental health, stabilizes lab values long-term, in that outcomes may vary, with trans women often needing more tailored care than trans men for adherence, though overall mortality risks aren't directly increased by hormones themselves, but by related conditions. So yeah, I'm not seeing any studies. It seems like they have...
Exactly, that's what I'm saying.
Yeah,
That's my point.
This is saying the opposite of what you're saying. This says it's over a decade study with up to 15, 16 years follow-up, and there's no shown evidence of increased mortality from this. Or specifically,
it's not just about mortality necessarily, right? If you're going to mess with someone's brain, that's going to happen.
Overall mortality aren't directly increased by hormones themselves. So like that's saying the opposite. Of the longest studies we have, of the longest time periods in which we've studied this, we aren't seeing anything that you're arguing.
What am I arguing, sorry?
You're arguing that we don't know the long-term risks, so we shouldn't let anybody take it.
That's right. So what were you looking for that the study claims?
Over a decade, up to 15, 16 years of follow-up, I would say that's a pretty long-term study. Are you only going to accept a long-term study if it's 30, 40 years? Or do you think based off of this long-term study, we can have a certain level of reasonability with what we can trust when it comes to this medication? Because you said before, if we had long-term studies that affirmed what I was saying, you would change your mind completely on this topic, and you would 100% support 14-year-olds taking both of these medications. Do you hold firm to that stance?
Sure. If it's really a good study and it's I mean, I definitely think that more time should be allowed. However, what's the sample size of that study?
It's referencing a few studies actually. Let me see. There was one examining 37 trans women on hormone therapy
37.
for over a decade, 12.2 to 41.6, comparing cognitive function to cisgender individuals. There was a
37.
large study of 755 individuals found trans AFAB assigned female at birth more frequently achieved hormonal targets than trans assigned male at birth, highlighting potential differences in treatments needed.
Okay, so that's not about risk. So far we've got 37. A sample size of 37.
This one says mortality studies. Large analysis studies suggest no direct increased mortality from hormones, but link higher risk to outside factors like suicidality, substance abuse, emphasizing careful monitoring. So not disease or any of the medical risks that you're trying to imply could exist.
But I mean that could imply that it's not working, right? Down the line.
That what's not
Say
working?
15 years.
What do you
The
mean?
treatment.
This doesn't say
The
it's not
treatment's-
working. That says there's no increased risk. Are you talking about suicidality? That's like due to people that like, you'll see that in people who
It's due to what?
transition as well. That's because they're more publicly trans, so they get bullied for it. Like, come on.
Okay, so it's not really a complete treatment then.
Yes, I hate to break it to you, but taking hormones does not make everybody around you so much nicer to you. It doesn't do that, and I don't think that was on the bottle.
No, of course not. But that's sort of still part of the problem now, right?
Yeah,
kid who
the
hasn't
bullying
taken
and
hormones.
harassment coming from rhetoric of people who disagree with trans people's existence overall. Yes, that should be fixed. Not just saying
Yeah.
trans people are delusional or not real or valid, like other people
Right.
try to impose.
So what we're doing is there's a kid who's getting bullied severely because he's different. He feels like, he's born in the wrong body. We give him some hormones. Down the line, he still gets bullied. Oh, he's still got an increased rate of offing himself. Do you think that's really like a good treatment?
Where does it say down the line it has an increased rate of
Is that not what you just read?
This is just saying that there's still higher risk to being trans of self-unaliving. It's not saying later down the line your self-unaliving rates increase. That's not what it said.
Right, but
I
it
just don't think
increases.
you're listening. I think you're hearing whatever you want to hear.
But it sounds like it increases from the baseline right after treatment.
Based off the treatment, larger analyses suggest no direct increase in mortality from hormones, but link higher risk to outside factors like suicide or substance abuse, emphasize careful monitoring. Notes from National Institutes of Health.gov. Let's see this one specifically. Oh God, not Google Scholar.
Nothing wrong with Google Scholar.
Yeah, but it just opened a bunch of things where I was trying to find one specific thing. Okay. Both transmasculine and transfeminine groups were more satisfied with their body post-operatively with significantly less dysphoria. Body congruency score for chest, body, hair, and voice improved significantly in 40 years post-operative settings, with average scores ranging from 84.2 to 96.2. Body congruency scores for genitals range from 67.5 to 79, with free, something I'm probably not going to say on TikTok, showing highest scores. Long-term overall body congruency score was 89.6. That's amazing. Improved mental health outcomes persisted following surgery, with significantly reduced suicidal ideation and reported resolution of any mental health comorbidities secondary to gender dysphoria. So if anything, there's much evidence to support that your mental health actually improves if you have gender affirming surgery to treat your gender dysphoria.
Surgery?
This was specifically referencing surgery. It said post-operative.
Okay.
It said post-operative.
Okay, so it's a bit straying away from HRT.
Okay,
Sure,
buddy.
that could be a good treatment.
You just can't take anything. The whole
No,
point
it's
was
that
they
I'll only take
HRT.
evidence that is directly related.
Stop being bad faith. Stop. You're
It's not
just
bad faith.
refusing any evidence. Shut up.
No, I've
Shut
accepted your evidence.
up! You're not listening.
It's just not the
I
same
get
as
it.
what
You
you're trying
have
to
your
claim.
fucking narrative you're so attached to. And when you get evidence that doesn't support it, you just don't want to listen to it. But like, just listen to it. It's
Yeah, when I
very
get evidence
clear.
that doesn't support it,
These
I'm not
are
going to listen to it. Exactly what you said.
okay, yeah, don't listen.
Exactly
Go
what
for
you
it.
said.
Go for it.
That's
Go
what
for
you
it.
said.
No,
Anyway.
please ignore me. Go ahead. Go ahead. Make your point. Go ahead.
Right. So I recognize that it can be a good treatment, especially short term. However, it also doesn't sort of negate the whole belief system of it anyway. Right. I understand that you can treat it, make it better, but it doesn't address the root cause why this person feels this way in the beginning. It's not that they're born in the wrong body. It's that there's something else going on. You do also realize that transgender people have a high correlation to autism.
Yeah.
It just shows that there can be something else going on.
Okay.
You didn't know that?
I said I knew that.
Okay, my bad.
I feel like there's medical information, misinformation with that because I'm not the most read person on that, but I know a lot of people contest that claim specifically.
You can check W
And
past
I don't think it was proving any point that you were trying to prove here. If you're just trying to say like, well, people are autistic and trans, so they're what?
No, I'm just saying
valid,
that
or they're
being
delusional.
trans is not necessarily the cause.
Also, I feel like you did lie earlier because you said that like, oh well. Okay, now I'm going to make my first point and then I'm going to go to that because you completely ignored all the facts that I presented. You're just like shifted the goalpost from like, well, actually, I would let 14-year-olds have this treatment because there's no medical risk. And then suddenly when the medical risk aspect didn't agree with your narrative, you switched it to actually change the root cause of their beliefs about this or why they are who they are. I feel like that's what you shifted to. And also, I'm going to finish my point because you clearly didn't want me to finish it before. Also, the evidence I provided when it comes to post-operative, that logic can also be provided to post-hormones because it has a similar parallel in both things of addressing gender affirmation, whether it's their appearance, their voice, like possible hair, breasts, or
it's
like
not.
other
Sorry,
aspects
it's not.
of their body.
Do kids get surgeries? Do kids get surgeries?
I'm gonna finish my point.
Kids
Sorry
under
it
18
upsets
do not
you.
get surgeries for
Sorry,
this.
it
It's not the
upsets you. I'm
same
gonna
thing.
finish my point. So you were trying
Kids get
to dismiss
kids do
that
not get
study,
surgery.
which
It's not the
oh
same.
my god, buddy, you gotta wait your turn. I just let you yap. Let me fucking respond. Jesus, I'll try to be faster because you're so impatient. I was trying to say specifically that when it came to this, there was a long-term study, not short-term results like you were trying to dismiss as. It was long-term study of over 40 years. The evidence was much in support of my claim that there are no evidence to support that long-term risks of what people try to claim outside of what we already know are happening to people who take HRT long-term. And at that age, like where you're going to be taking puberty blockers or later, HRT, you would have the information available to make that informed decision with your parent and doctor present, right? Which is why there's a waiting period, which is why there's therapy, which is why there is time to make sure that they are not confused about what feelings are there and they know who they are, especially when it's more affirmed in society every day that we know who we are more than you tell us who we are when it comes to queer people. So that's my point in response to that. As it comes to the earlier point, specifically when it came to not addressing the core issue of it, you can have a difference of belief of whether it's a real thing or not. But I think it's just like people's perspective on that is so warped because it's like you're trying to say it's a delusion and then you're trying to say, well, the only reason they can like have these certain feelings is because they're just confused or they're crazy or they're delusional or something. But people just have genuine differences of belief about gender constructs in society or views of gender from society to society. And people can have a belief of the separation of gender and sex, which is why there's these incongruences that happen with trans people. Right? That's why that exists. There's these incongruences because not everybody fits into these molds that you're trying to paint in society of male and female equals man and woman. That was my point.
Just to clarify, we're sort of changing them biologically because they don't understand social constructs. And also, I don't think that it's okay to compare giving HRT to kids who are still developing to adults who are doing surgery for their transition, right? That's not the same thing at all. That's not the same thing, right?
When do they get those surgeries?
Does it say they're kids? Because as far as I know, you can't get a surgery for transitioning. Do you know anything
about it before saying that they're just adults?
So what country allows you to surgically transition as a child?
I don't know. I feel like you're the one speaking on this. You should have all this information readily available.
No, sorry, you pulled up a study. Do you want to bring that study back?
It didn't mention the country.
Right. It doesn't mention kids, which is what we're talking about. So when we talk about the long-term risk of HRT in kids, for kids,
let's see.
No, so it's irrelevant. It's not what we're talking about.
Seen for gender dysphoria at the Tertiary Care Center from 1970 to 1990 with comprehensive. You'd have to look deeper into it to see the ages of their starting age, but it seems like it's pretty. Of the 97 patients that were seen, it's pretty much a consensus with these percentages when it comes to like scores ranging from 84.2 to 96.2, 89.6 when it comes to body congruency. I feel like that's not something you can just say, well, whether they were old or young won't make. It's like
hang on, because you're moving the goalpost now. We're talking about HRT for kids. We were talking about HRT for kids.
You're just assuming they're not.
Post-surgery
they could have been 18,
for
19,
adults.
20 when they got these surgeries.
Right, and I think that would be fine if kids waited till 18 to take HRT. At least they're somewhat developed. At least they have somewhat of the ability to consent. So you're moving the goalpost here. It's not the same thing. Don't try and claim it as the same thing.
So no, it's not about long-term studies anymore. Got it.
No. You just don't understand how to compare these things. And they're not the same.
Sure, just any evidence to provide is just never enough.
You didn't provide evidence at all.
I mean, I provided multiple studies and sources. You just don't like them. You think they don't apply.
No. Do you not understand? We're talking about children taking HRT, and you're bringing in a study of adults, because kids can't get surgeries for transitioning. So you're bringing in a study of adults and surgery, not kids and HRT. You do get the difference, right?
Yes, I understand the difference. We were talking about the long-term results of whether they knew who they are, which is the claim I was addressing with that specific study.
Okay, so you're making that claim again. Just like kids who know who they are, who don't have consent, they don't know who they are, clearly. Or adults
at 18 years old, they completely understand who they are.
Well, they have a better idea than when they're, say, 15, 16, right?
Which is why there's a waiting period and there's therapy.
For HRT?
To help this self-discovery and understanding. But even with that, if you did a poll of people who are trans or gay or in the queer community, at what ages they actually understand who they are, I would say it's very young where you understand who they are, when they have same-sex attraction or whether you have gender dysphoria appearing at certain ages or understanding that you're different from people around you and understanding these feelings. That's extremely young ages from the people we've seen, of everything that we've seen.
Let's just allow kids to
people are in denial
15, 16,
for a bunch of years because their two-either appears that they're delusional or crazy, right? That's harmful to them, their self-discovery. So you shouldn't be spreading that narrative at all.
Right. So let's just move the age of consent to, say, 15.
Who's arguing for that?
You, because you're saying they know who they are.
No, stop lying about my position, dumbass. That's not how that works.
Right, well, you're not making a very
coherent point. You just don't know how consent with parents and doctors work, and it's sad that you have to paint my position in a bad faith attempt to try to defeat my position, rather than the actual...
You're saying they know who they are. You're saying they know who they are.
That's right. Okay, knowing who you are as an individual, just because I knew I was attracted to men in 4th grade, doesn't think I should be allowed to have a tattoo in 4th grade or drink in 4th grade. I feel like
that's what
fundamentally don't understand the arguments that are being made, and the only way for you to argue against it is to be bad faith as fuck. Because you provided no studies of the opposite. You're just demanding study after study after study of anything in affirmation of my point. Where I feel like I'm providing a lot of relatively decent, good information about people did understand who they were at younger ages, and this definitely had help, whether it was HRT or post-operative, for decades. I showed you one with 10 to 15 when it came to HRT, and then I showed you one for 40 years when it came to post-operative, and nothing's ever good enough for you because you don't like information that doesn't affirm your fucking narrative.
Buddy, that's not true. You're bringing up studies that aren't relevant at all. And I don't need to cite a study because I'm saying there's no evidence or not enough evidence. All right, I did say WPATH. You can look at WPATH. You know what WPATH is?
No.
So if they're advocating for more research, then, that's probably quite telling.
Okay, cool. Does that disprove anything I just provided?
Did you provide anything relevant? You're talking
It
about
seemed like you were
adults
pretty much
post-op.
conceding earlier before you made that post-operative shift and moved the goalpost. So, well, it doesn't change the belief. They don't know who they are before you made that shift, right? It seemed like you were coping then, and then you switched up. Did everybody
It wasn't really a shift. No, it wasn't a shift. It was just sort of
I think you're having a little bit of short-term memory, Josh, but it's okay.
No, I know what I said. It wasn't a shift.
Well, then you should be able to completely remember.
There's also this. Yeah, I agree. It doesn't actually change the fact that this is still a belief and nothing more.
Cool. All right, we can just keep looking through study after study until you find one that's
okay. So can you find a study that is for kids on HRT, not adults post-op? Because it's not the same thing. You do recognize that, yeah?
Okay. How many times do I have to say yes? You've asked that same question.
Stop saying that that's a good source. Stop saying it's a relevant comparison. Because it's not.
You just stop being bad faith and address what I'm saying. I said I understood the difference.
But it's just that you're using that as a crutch, and it's not even relevant. I'm not using it as a crutch. You're using that same question as a crutch to not address anything that I'm saying. Are you going to admit and affirm that post-operation, long-term, there are benefits to being on this, having this surgery? Sure, that's great. That's not the point. That's the conversation we were having. So why are we talking about that? Where did that come from?
The whole point that they don't know who they are.
Hang on, those are adults, right?
Cool. Are you going to say every single one of those adults didn't know who they were as a child, even when majority of the polls that we see show that trans people know who they are at young ages? Are you going to say that they just didn't?
You know, we were talking about kids. So if anyone's moving the goalpost here, it's you.
Great. I knew who I was in 4th grade about my sexuality, and most trans people tell you they knew who they were at extremely young ages. Why are you just assuming that we don't?
Because they're kids.
Cool. So the boomer logic of you actually don't know who you are, so I'm going to assume that you're just delusional or crazy. That's like such caveman fucking logic. I just gave you example after example
decisions like that.
Examples of people who were kids and knew who they were and then became adults and still knew who they were, and nothing's ever good enough to you because you assume that kids don't know anything about themselves. I hate to break it to you, but kids can know some certain things about themselves. They can know their what foods they find good, what colors are their favorite, what career path they might see as that might be fine. Like certain things. Okay. Sure, you can make up your mind about a lot of things, but those things that are core to who you are as an individual don't really change. Like my sexuality
so they know enough.
My self-identity as a man didn't change. My understanding of who I am as a person didn't change. Like you're just assuming that every single thing about children change.
They know enough to justify taking a medication that has permanent side effects.
Yeah. And the evidence supports that. That's why the detransition rate is so low.
No.
That's why.
Just say that kids can consent, buddy. That's all you need to say.
Kids can't wait. No, kids can consent. Like by law, currently, kids can't consent to some of their medical care and medical records by all 50 states. I just made sure. And in a lot of the 50 states, majority of children can consent to hormones, whether that's estrogen, birth control, even regarding cisgender children. STD care, pregnancy care, substance care, different things like that. So yes, majority of cases they can consent when it comes to this particular thing. Also,
like permanent medication?
Yes, including birth control, because birth control is a form of permanent medication. It permanently affects your body. Majority of children get their birth control at the age of 12.
Mm-hmm. But we know that that's at least somewhat safe, right? We know that long-term effects of birth control.
So yes, we do, but it's still a lot of side effects. And that's why even with this study that I'm going to bring up, 40724685, it talks about the long-term effects of HRT and puberty blockers on the youth, and it doesn't necessarily say trans youth because many cisgender children also receive HRT, and it talks about the long-term effects and how they're not significant, and how they weigh basically the same as birth control on children, and STD treatment for children, because some children do have to take STD and STI medication due to whether that was being born with it or contracting it through rape, incest, or just sexual activity.
Also, I do have one. It's more of an. It seems like an article, but it seems like it's referencing a study. I'm trying to find the study behind it.
So when you say cis kids are taking HRT, they're actually not taking the same dosage and they're not taking it for the same thing. They're not trying
So I
to
never said
replace
they
the
were
hormones.
taking it for
It's
the
for
same
regulation.
thing.
Yeah,
Some
so there's a
cisgender
difference
children
between
do take
regulation
it.
and replacement.
So some cisgender children do take it for replacement, as some of them have PCOS, which causes their levels to be different than the average quote unquote
So
cisgender
regulation.
child. But that's not necessarily regulation, due to the fact that that's how their body naturally does this. Also, for me, for example, I had to take estrogen due to my birth control. So even though it's not for the same reason, they are still taking HRT.
Right, at the same dose?
For some, yes, not all.
Are you sure about that?
Yes.
You want to double down on that?
Yes, I can. I can actually prove it if you want me to.
Yes, please.
Okay. Could you prove otherwise?
I don't have it handy, but I know it's a different dose.
Okay, but could you prove it?
You know 100% that it's different dose
For
in
everybody
every
along
situation.
the board.
I mean, I know there's extreme cases for everyone, but
Okay, so then that's what I said. I said for some, yes, for some, not.
okay, but just let's say I took, say, the highest dose of HRT you could take. That would be an extreme case. That doesn't really prove anything, right?
What do you mean by that?
Okay, hold on. I just want to read
I
this real
recognize
quick
that there are
before-
extreme cases.
I just want
That
to
is
read this
no
real quick,
way
'cause this is
the general application.
If anybody can help me find the study behind this, this is a media press release from 2019. New research shows how transgender hormone therapy alters medical test results in the long term. And this is the part that references long-term health impacts that they've seen. It says it's behind a 2018 study, a team led by Jeffrey Sorrell, MD of the University of Texas Southwestern Medical Center in Dallas. And they did a comprehensive metabolic panel, complete blood count, and lipid test results for 147 healthy transgender patients on hormonotherapy over the course of 5 years. This is the longest lifetime study that any study has monitored transgender individuals to date. And it was saying that red blood cells and creatine levels underwent the largest shifts for the first few months and then stabilized after 6 months. In transgender women specifically, platelet and low density lipoprotein levels increased after several years of hormone therapy, while alkaline phosphatase decreased steadily over a few years before returning to baseline levels in the long term. Knowledge of these trends could greatly improve healthcare provider shit. Okay. And then monitor these results for conditions ranging from anemia to heart disease and kidney failure. So that's what it says. But it seems like most of any of the negative effects when it comes to your health return to normal over long-term use that we've
They're
seen.
not significant, yeah.
Yeah. From 5
That's
years.
the study I have.
Because it says 5 years, and then this one says
The kids in
after
the study?
several years of hormone therapy.
Sorry, how old were the kids who started this study?
It's a 2018 study. You'd have to see for yourself, but this is about healthy transgender.
I mean, since you put it up.
Mine's is for-
transgender
kids?
patients. So that would be
so not
if it's
kids.
transgender patients on HRT.
Oh, so not kids.
Okay.
So not the same. Not what we're talking about.
No, I'm not laughing at y'all. I'm laughing at the fact that she said she thought that psychiatry wasn't medicine. That's what I'm laughing at.
Wow. Hold on, let me see. Let me see if I can find this study.
The one I have is from 2025, July of 2025.
Damn, that's a recent ass study.
It's from July 10th, 2025.
And where are you finding that study?
From the NIH.
And how old were the kids in that study?
It doesn't list their. Actually, let me double check.
Oh,
What's,
but they
what's
work.
Majority of
what do I
studies,
search in NIH to find the study?
4072
Mm-hmm.
4685.
Nothing came up. Do you have to go to a certain page first to type that number in? Is it
I'll
website
show you.
archives?
Yeah, it should just be like, it should just tell you like number. On my screen, it just has search, and then I just search. It says search the number. Oh, hold on. Yeah, that's it. I'm gonna type it in chat because I might be saying it wrong.
I have the right number. It's not prompting a number search. What website specifically prompts the number search?
It's just the NIH. Hold on. When I go to their home screen, if I go to their home screen, it just shows me this. I go to click this, the search part right here, and then I just put the number in here, and it comes up. If you can search up PMID in Google and put that in there, and it should come up. That's how I find mine as well.
All you guys are really doing is proving my lack of evidence claim for kids.
Wait, no, this
I
is
still
for
haven't-
children.
It is?
Yes.
All right, I'll stay for this. What was that PMID again?
4072 4685. I'm gonna keep it right here so everybody can see too.
We definitely got some people in requests though, so I don't know. If their only claim is that, well, it's nothing to do with the beliefs of being trans, it's everything to do with literally just medical risk, I would say that there's a lot of evidence when it comes to as long as studies as we can do, whether it's 5 years or so, because I was in 2019, I don't know if we've done any longer term ones since then, but minimal risk when it comes to medical, like any complications when it comes to HRT. I'm sure some of them were children, you'd have to see, but if you don't want to take my word for it, you don't want to look into the study yourself, that's fine.
But you've sort of brought the study up. It's on you to prove that they're children, and you haven't done that.
I mean,
so
yeah, but
I'm
you
not
don't
gonna
really
take that
care
as
to look
evidence.
into any of the evidence
No,
of it.
I do. But you've sort of confirmed it's on your own that it doesn't state age. So we're not going to apply evidence for kids that is not.
Wait, no,
for
it does
kids.
state age in this one. It says minors. So anyone under the age of 18.
18. Yeah, this just says transgender clinics. It's not saying any. It's just an abstract. Where are the fucking aspects of it?
Hold on. Let me see if I can. Well, you want to try it from the title?
This is transgender women and transgender men, so I'm assuming adults. Those for 5 years, so it's probably for adults at 5 years.
Also, Solo, what I'm explaining to you is that if you are studying medicine, you know the importance of research, as research is what our clinical experience entails.
All right, well, keep looking at those studies. From what I've seen, I'm not seeing any evidence of long-term harm from HRT. I'm not seeing any evidence to support that it would be if we have minimal harm when it comes to adults taking this medication. I don't know anything that would lead me to believe that it would be so much worse for 15, 14-year-olds taking the same medication. Like, I have to know what specifically about it the medication changes based on age. I'm sure it could have a different impact on like certain levels of things, but what it actually changes about the body should be pretty similar. If I'm
No, so we do sort of prescribe medication differently for kids and adults. Like you said, the COVID vaccine, that was not given so easily
yeah,
to
but it's like,
children.
are there
It
different
had a
chemicals
lot
in
of
it, or is it
research
just a
before that.
different proportion?
No,
So-
so kids are still developing, so they're still malleable to any of these changes. They're more at risk than an adult is.
So I would say that depends on the medication per se, because for certain medications, children receive similar doses depending on age. And also, they don't just like, when they give a HRT, they're not just giving like the max dosage to a child. That's not what they do. They give an age appropriate dosage and then it increases over time. It's the same way they prescribe like estrogen for minors versus estrogen for that's not what, sorry,
but
I got distracted.
guess what? We
Estrogen
don't
for
know
It's
the
like,
long-term risks.
also we can't ignore the aspect that it's like you care so much about these kids' health, but if they don't get this medication, their likelihood of self-unaliving like raises. And I feel like you're just like not accounting any of the positives that this can do of a smoother transition or the benefits to their gender dysphoria, their self-perception, anything like that. I feel like you're only coming out of it of trying to find any excuse not to and not recognizing any of the positives.
No, I'm saying wait 3, 4, 5 years, buddy. Come on. Plus, I'm reading this study now. I don't think it's about HRT. It's about puberty blockers. Right? If we look at the methods, it says, where is it? Resulting in 20 articles focusing on children and puberty blockers, and 40 articles concerning adolescents and puberty blockers. None of this is HRT. So it still doesn't prove anything.
if I'm not
And from what I know, it's also not a long-term assessment.
give me 1 second actually.
So it seems like you guys are just sort of grasping at straws to find anything that backs up your point, but it's not working. So anyway, I'm gonna jump down. I'll let someone else come up. 'cause
I mean,
Wait,
if
okay.
your argument is just like we shouldn't allow this medication because we don't know the long-term risks, even though we know the short-term risks when it comes to this and the short-term benefits and the long-term benefits of being on this medication or having of like these gender-affirming surgeries, it's just like you can believe that. I choose to have more trust in these medications and the methodology that they're using, but you don't have to trust it. But I think that they can still make informed decisions based on the amount of risk that can have.
People 50 years ago believed in
these kids'
lobotomies,
mental
so
health too.
it's
Like
just
that's
not
also
really
a
enough to-
risk.
Wait, lobotomies
Trust.
weren't informed medication though.
What wasn't?
Well, that's actually not
Lobotomies.
true, and they were being prescribed by doctors. So it's
Yes, it
I'm
was
just
being
saying you shouldn't just
prescribed by doctors,
blindly
but
trust
it wasn't necessarily
procedures
like,
and medications. You know,
huh? I
You do need to
agree,
do some
but like
digging into the
like when
long-term
it comes
risks.
for one, when it comes to lobotomies and our advancements since then, it has been very drastic, and we have increased more ethical regulations than we have from back then. Like a lot of things were considered quote unquote medication back then that weren't necessarily like
Also-
medication in the sense that we see them now.
Also, I
But
just
like
want
the
to say,
host is
Josh,
saying,
were
we're just
you
gonna
the?
trust. We're just
I
gonna
just want to
trust the
double check,
process.
Josh. Were you the person in here that compared having gender dysphoria as a trans person to being schizophrenic?
Yes.
I don't think that's a scientific take. If
That's
I'm gonna be
not.
honest. I don't
No,
think.
it's
I think
not
the
that
fact that
I'm
you think
comparing
that's
them directly.
comparable is kind of
However,
concerning. And I feel like
I'm
I pointed out
comparing
the
the
differences
treatments.
many times, and all you had to say to that was like, "But they have gender
The treatments
dysphoria,
are-
or it is a delusion." Like, I don't think you have like any evidence because
No,
like
what-
you know that your solution to that is to say that it's a delusion and to say the other thing because like I feel like you're lying. I feel like you've lied this entire life and you're engaging in extremely bad faith and you're trying to make this medical argument as, oh, well, if there's no risk medically, then it's completely fine. But you already
that's
in
what you
yourself
feel like, 'cause you've been
compared
put
it
in
to
your
an
place.
extreme delusional syndrome and say that you should not be affirming it and you should be saying that it's not real and that like a boy cannot
That's not
become a
what I'm saying.
girl or something like that. It feels like that's the point you're trying to make by making that comparison to schizophrenia. Am I wrong? Was that not the purpose of the comparison?
That's not the comparison I was making.
Cool. So what was the point of the comparison then, if that wasn't it?
Right. So I recognize the treatments of both schizophrenia and gender dysphoria, right? They're good treatments. They work. However, treating something is not the same as knowing the root cause and understanding that root cause, right? So why are we just sort of believing that these kids are born in the wrong bodies when we know that's not the case?
Okay, I feel like we're
We're
automatically
affirming
under the
this
assumption that it's a
the
bad
delusion.
thing. I don't think being trans in itself is a bad thing. I think being born in like the wrong body, I just think like you're born in the body you have, and the gender constructions that society has are also there.
But
And
you
like you
understand
can
that's
fit
the
into
narrative
these
that is
boxes
pushed.
or not fit into these boxes, but I don't think it's bad that you don't fit into these boxes.
Right, but that is the narrative that's pushed, and that is sort of how it's portrayed, is that you are born in the wrong body from birth, you are trans at birth because you're born in the wrong body. That's not
Because the
true.
whole
We
wrong
know
body
that's not true.
concept is that your gender identity is tied to your body when people equate gender and sex. That's the whole point.
Right,
That was our
really
understanding
the
of
point
it.
is there.
That
You
was our
don't align
language around the
socially.
issue.
So you don't align socially is the real issue there.
Your
So why are we
social,
messing with
your social
biology when you
identity
just don't
based
fit
on
in
your
socially?
self-perception and how you fit
Can
into
I
society is
say
different than the body you're,
something?
like the
Right, so
way
that's a social
society
issue.
prescribes who you are based on the body you're born in. That's the
Wait, can
difference.
I
Great, so that's a
say a
social
couple
issue.
things? Wait, really quickly. I just want to like say a couple things that you said that were false. One, gender dysphoria is not the same as schizophrenia whatsoever. Also, you keep
I
saying
didn't
your
say it
lack of
was.
critical thinking. I'm not just addressing you when I say this. The person that is in the comments, this is actually to the T what I study. So when it comes to this particular topic that we're talking about currently right now, this is my kind of expertise. But
Wait, but
gender
can I ask?
dysphoria, or when it comes to transgender people, it is not related to being a delusion at all. Gender dysphoria is not considered a delusion. Delusions are something completely separate. Two, when it comes to the root causes of schizophrenia, we do understand the root causes of schizophrenia. We know that it's not a single cause for schizophrenia, just like we know for other mental disorders / mental illnesses, such as depression, anxiety, autism, ADHD. It's not necessarily a single cause. It is multiple different things that can cause it in multiple different people, including genetics, brain chemistry, environmental factors, the whole nature versus nurture thing.
Okay, but you're proving these claims
And
that no one
then
made.
you stated that you definitely
No, I
did
said,
state you definitely
yeah,
did say that we
we know
don't
the cause of
understand the root cause of
schizophrenia.
schizophrenia. Wait, you definitely just said we
No,
don't understand
understanding
and
that is
address.
different
Wait,
from
hold
treating
on.
it.
We treat the root cause of schizophrenia. That's why we have to understand the root cause of schizophrenia. We
Do
understand
we
the root
treat the root
causes of
cause of
things.
gender dysphoria?
Yes. Wait.
Wait. Your
Oh
issue
my
isn't that
gosh.
we don't understand how to treat gender dysphoria. We know how to treat gender dysphoria. Your issue
I
is
know.
how do we
Well,
treat
what's
the
the root cause?
trans issue. That's what you're saying.
What is what is the root cause?
Wait, have you looked into it? Have you?
We have reliable treatment. The treatment is affirmation. We know it has reliable evidence to support that it reduces gender dysphoria.
No, that's not the cause. That's treatment.
Wait. Okay,
Cool. That's
wait.
not what we're arguing. Okay. But the
Also,
whole point that
really
you're trying to
quickly-
argue is what is the root cause of gender dysphoria to you if you know that cis people can get gender dysphoria too? It's not trans being the problem. So I don't know why you're trying to make this comparison between being trans and having schizophrenia.
Also, when it comes to what I'm speaking about is your comparison towards schizophrenia and gender dysphoria, stating that we don't know the root causes of both of these things. When we have a solidified answer and evidence for the reason why individuals are experiencing schizophrenia, why, and we
That's not my
can
claim.
showcase. You literally did say that. When did you not say that the reason why they are comparable is because we do not treat and understand the root cause of schizophrenia and gender dysphoria?
Did I say we don't treat schizophrenia? Sorry, what? Where did you pull that from?
The root cause. You literally just said that.
No,
if I'm not
We could have been
I'm
talking
saying
over each other.
we
We could have been
treat
talking
both
over
of
each
these
other a little bit
conditions.
because of that.
We treat both of these conditions. That's great. However, it's not the same as knowing the root cause of a condition, right? So we do know that for schizophrenia. Do we know that for gender dysphoria?
Yes.
No. But
Yes.
the narrative being pushed is that people are born in the wrong bodies. And that is
Wait,
not true.
we
It's
do
not based on
understand the
any
root
sort of
cause.
science.
Wait, we do understand the root cause. That's why okay. Let me start from the beginning.
Well, it's like
we do understand the root
it's like
cause
a
in that-
combination of body dysmorphia and your gender not aligning with the how
Yeah.
people perceive
Right.
gender
So
in
they've got a
society.
social issue.
That's how I see it.
scientific. Also, in the scientific terms, they say it is the complex intersections of biology, environmental, and psychological factors.
They've got a social issue about
Have
not
you
aligning in
researched any
society.
of this?
I have.
Okay, could you
Have
prove?
you?
Could you give a
Sorry, are you
source?
studying this?
Yes, yes. I graduated this
So why
semester.
are you bringing up
So
studies that
could
aren't
you
even sort of relevant to
could
what we're talking about?
you
Because that
could
study
you
you brought up before
prove?
is not even.
Okay,
Anyway.
then maybe I misheard you because I definitely thought you also did say puberty blockers. That's my mistake. But again, could you
Well, I feel like the
provide
first
a
time you brought
source?
it up in this conversation, you were talking about puberty blockers, and then you switched it to HRT. When you were talking about the
No,
long-term effects of it, you were quoting a lot of the long-term effects of puberty blockers.
actually,
Also,
you brought up puberty
could you?
blockers. I just said HRT is the harmful one.
Okay. Well, could
Okay,
you
I feel like we're
prove?
forgetting the
Could,
first part of this conversation, but sure.
yeah, and I'm not gonna let you pivot. Could you provide any sources for anything you just said, including that we don't know the root cause of gender dysphoria, how the long term effects of HRT, since you're saying you only said HRT, is detrimentally or significantly harmful to the youth. Could you prove any of those two claims, like with a source?
So the second claim is not one I've made. I said that there are no long-term effects studied. But yeah,
Okay, could you prove that?
WPATH standards of care. You can see they state themselves there is not enough long-term neurodevelopmental
Okay,
studies
then
into
could you
that
prove?
risk.
Could
What do you
you?
mean
Okay,
can't prove?
could you prove that? And two, could you also prove that even without the long term studies, let's say that this claim is true, that even without the long term studies, that it's significantly detrimental, that we should not include it in practice today.
Sorry, isn't that
Because
just
there's a lot
basic
of different
ethics? Should you
Should not
medications.
know the
include
risk of a
what?
medication before you prescribe it?
What you say?
Should not include what?
Oh, I stated, if you're stating that we don't have enough information on long-term effects, could you prove that? And two, could you prove that even without, the quote unquote, not enough information on long-term effects, that HRT, is detrimental or significantly harmful, with the
That
information
wasn't
that
my
we do
claim.
have? I'm not stating that is your claim, but you're not understanding. I'm asking you to prove that as well.
I mean, I also think like we need
To
to
prove
have
a
a
claim that I
realistic
didn't make?
conversation. I feel like we need to step back for a second and have a realistic conversation about what we're talking about. We know the short-term harm of not allowing this treatment. We know the short-term benefits of allowing this treatment. We know how it impacts the lower rates of schmuicidality and like the gender dysphoria aspect of it. We know that the treatment is beneficial, and the only negatives that come from this are from outside sources, whether it's finances, whether it's like how your peers are treating you based on this transition. That is where the negatives come from. It's not from the treatment itself. Yes, so there are medical risks, but those are minimal and can be accounted for. Like I just feel like
buddy.
I feel like you're just
you're
saying like, well, no matter
not following
what
along here.
the positives are, the potential risk 40 years down the line is why we should make it all illegal now. And I feel like that's not a logical position to take.
I'm not saying let's all make it illegal. I'm saying not to kids. You do understand what I'm saying.
Illegal for children
you
to
keep sort
take.
of
How about
pivoting
that?
to something else.
still
Illegal
have
for
to
children
prove
to take. How
that
about
it
that?
So wait 4 or
Illegal
5
for children
years,
to take.
and
I'll
then
make
you can
another
take it as
clarification.
an
Illegal for
informed
children
adult.
to take for gender affirming reasons.
So that's also what I'm asking you to prove. So like if you're stating that because it's not enough quote unquote studies, could you prove with the studies that we do currently have that it is most likely harmful and not most likely beneficial with the information that we currently do have?
He's just going to say it's inconclusive and there's no way you can tell because they're so insufficient.
Because we don't have with certain medications that we give to people, it is not necessarily long-term studies in the way that we'll be able to say this will happen in 50 years. Like as in that has been a study, but we have studies that will showcase this is what most likely will happen in 50 years.
No, I'm not going to pull up a probabilistic study of what I didn't claim.
I mean, it's all right, Kate. He's just going to make a final statement because we have to move on to somebody else. We've been going on this too long.
I'm happy to drop now. I'm not going to bring up a probabilistic study of a claim that I didn't make. That's not how that works, okay?
You
That's
didn't
very silly.
listen to what I said.
But your claim is the
provide a
stuff
source
we
for the claim
don't
you didn't
know
make
is
is what you're
more
saying.
harmful than any of the positives that we do know. That's what it's. I feel like we're circling at this point.
A few years. Is it really that harmful to wait a few years till you're an adult? No, I don't think so.
Wait, yes.
No, it's not.
With the information we do have, we understand that it is harmful and that it will most likely cause mental health issues when it comes to the youth.
Especially when I was making the point of like a smoother transition. There's so much evidence to support that a smoother transition is so beneficial when it comes to lessening gender dysphoria and improving like quality of life and like a passability, which has an impact on your social treatment as a trans person as well.
Right,
It is
and I'm
also
sure
a
if you start
privilege.
smoking as a child as well, you'll have better stress, you'll have better
Okay.
anxiety.
Thank
Right?
you
It's
for
just not.
avoiding
You
any
can't just
argument
make
that
that
we
claim.
made.
So
Thank you for running from any
Wait,
argument that we just made.
no, it's just
no.
not. It's not very coherent.
Okay,
So
You're
comparing
I'm
not
gonna drop
proving
down.
any
schizophrenia to
claim that
gender
I'm gonna
you
drop
dysphoria. Okay,
down.
that's it. We're
made.
done.
You,
We're
you
done.
have a
Have a
good
good
night.
day. Thank you for running. Jesus Christ. Comparing schizophrenia to gender dysphoria and then comparing HRT at a young age to smoking at a young age, you knew you came in here with a fucking narrative and you were so unwilling to recognize any evidence of the opposite. And as much as you want to dismiss everything we're provided as no evidence, I hate to break it to you, there was plenty of evidence. It wasn't 20-year studies, but it was 5-year studies and it was studies on the operation aspect of it, that these things have impacts when it comes to passability, when it comes to a smoother transition, when it comes to your voice being more gender affirming, your body being more gender affirming, your social treatment being more gender affirming based on what circles you surround yourself with. And that has an extreme impact on mental health right now. If you were taking these medications, if you have the proper waiting period and therapy beforehand to make sure that you know what it's for you, right? Because we're giving that breathing room for, they're just kids, they don't know. Most of them fucking know without that anyways. But for those people who might not, that's why you give the therapy, that's why you give the waiting period. So if we account for this as much as possible and give these waiting periods, yes, a child with their parent and with their doctor who wouldn't recommend schizophrenia or cigarettes for you, like, come on, how bad faith can you fucking be? Would not, you can make these decisions with medical information.
Actually, now that I think about it, we could have just gave him a study on how estrogen or testosterone affects young trans
If it was,
kids. We can do that particularly instead of saying hormone therapy because it's essentially the same thing. And if I'm not mistaken, the studies on that state that it is no long-term effects on trans children. Like it's not a significant amount of long-term effects.
I believe it. It's just, it's like he won't accept any information that's affirming because it goes against his worldview that it's just fake. And as much as he wants to say, well, it's perfectly fine for adults to do what they want, or if there's no risk, it's perfectly fine for people to do what they want. But then this whole idea that, like, well, it's a life-changing decision. Why are you saying that? You just said 14-year-olds can take it, like, this, if there's no medical risk, 14-year-olds can take it. So why are you bringing this argument of, oh, they don't know who they are, or it's a permanent decision, or they don't, you have to treat the root cause of it. I feel like that's such a bad faith interpretation of that, right? Because like if you're just arguing the medical risk, you wouldn't be bringing up these other aspects. But yeah. Is there anything else you wanted to add? I'm probably going to drop you to go on to a next guest that disagrees.
Yeah, I'll give you another study. This one's on hormone therapy on bone markers, and it is 31159456. Any study that I see, I'm going to just put it in chat for you. Yeah, that's it. He low-key, he took me off my hiatus because I wasn't supposed to be debating until the new year.
My lives feel like they do that for you.
They do every time. That's why I try not to come in.
It's because whenever I go live for some reason, the more I drink, the more people want to fact check me on shit. I'm like, wait, hold on. Wait, what's going on? Like, and that's when you and Artemis come in here with the facts, and I always appreciate it.
LOL. I love that for us, honestly. But yeah, I just find it interesting, especially when people. What honestly was annoying me in the comments was people talking about like, well, we don't have to do research to understand simple biology, when the essence of biology is research.
Also, people pleading to biology is literally just saying gender equals sex, and therefore biology is affirming my statement. When people are literally just saying, well, gender doesn't equal sex. So it's like they're disagreeing on a social aspect, but they're pretending like it's a scientific aspect. Being like, well, science says gender equals sex. It's like, well, no, it actually kind of doesn't. You can have your personal conviction about gender equals sex when it comes to personal identity, but like in general, no, there's differences.
Zombie, could you get off my tip?
Oh.
You want me to read it all the way through? I can read it all the way through. I didn't read it all the way through. I read the
We don't got
fucking
time for you to
results.
read it all the way through. You gave Zombie the numbers, and Zombie can search that on their own time if they're
We can
so
read
ass
it
mad about
together.
it.
We could read it together. You
What's
want
the
me to
point of
read
the
it?
case? Case closed. We're good. There's so many people waiting in requests. Hold on. All right, I love you, Kay. I'll see you later, though.
Bye. Thank you, because I got to do the scholarship.
Also, your new profile picture eats. That coat is so cute.
I got it off Fashion Open.
Ooh. Okay, bye.
Bye.
All right, sorry. I know some people in here were waiting for a long time. Also, ops only. Let me know if you're not on op.
Hello.
Hey, how are you?
I'm good. How are you?
Good. What point did you want to talk about?
We can talk about do you believe that gay kids exist one first? Because that would be the fastest, I think.
Sure. Do you think gay kids don't exist?
I mean, I think that children can experience like same-sex attraction, but I don't think they should be labeled as gay.
What do you
That's like
think
a
being
big
gay is, if not
sexuality.
same-sex attraction?
I mean, I don't feel like they're kids. Like they might like be attracted to another sex, but sexual orientation describes like a whole stable pattern of attraction. And
Yes, but you
childhood
talk about
development
sexual
is fluid.
orientation incrementally, right? You talk about the romance first before you talk about the intercourse. So it's okay to understand like gay as romance before you learn about the sex aspect, right? Because I learned about straight people at an extremely young age when I was learning about princes and princesses, but I wasn't learning about intercourse at that age, right?
I mean, did you learn about it or did you just see it on TV? Because now we're seeing it on TV on Gay and Straight, right?
Well, I was definitely reading about it in English class, and I was definitely learning about it when it came to family trees, and I was definitely learning about it when it came to affectionate society, which I think was definitely talked about in history and English
Well, I think
at
now
younger
in
ages.
class they're learning about gay people too, right? Isn't that like what the whole big argument is about right now going on?
I mean, yeah, they're trying to restrict it though for a reason. Same reason you're arguing that they don't know who they are.
No, I'm saying that child development is fluid and incomplete. So I don't think you should put adult
Do you
identity
not think
in front of
education about the
children.
feelings that might be arising at those ages might help that development? Because I feel like sociology and any studies that we have when it comes to child psychology support that claim that the more information you have when it comes to age appropriate aspects of sexuality at younger ages, the more you understand and the more smoother transition you have into maturing as an adult.
How so?
I think if you limit education about gay people, the gay people in that area are much more likely to be DL as adults, to have denial, to have mental health issues around that suppression of their sexuality, a lot of insecurity around it as well, depending on social treatment as well, that could worsen that. And I think if, like, in the same way we demonize left-handed people, there was a lot of increased harm towards left-handed people being excluded from education and a lot of social treatment that differed when it came to left-handed people in society. And we have a lot of evidence towards the support that people who were left-handed, it was going to be a certain portion of the population, which is why there's that curve when it comes to open acceptability of a group and the amount of people who identify in that group. And it's not like conflationary, in which a lot of people try to argue that it's like more people are identifying than actually exist.
I mean, you cannot just tell the last boy, like, don't compare schizophrenia to being transgender. I don't know why you just compared being left-handed to being gay. That's kind of, you can't choose to be left-handed. You're just
Well, it's a good
left-handed.
argument when people try to say it's a fad or it's like people don't know who they are at that age, which a lot of people try to argue when it comes to being gay. And I think when you compare the curve that happens when it comes to being left-handed to being gay or to being trans in this country, there's going to be a curve specifically when it comes to the amount of people who openly identify versus when there is more societal acceptance and visibility of these groups and specifically education of these groups. That has an extreme impact on the amount of people who are going to openly identify with this. And to a lot of people who try to say, well, you just don't know who you are, I point to those same graphs to say, well, look, these are people who figured out who they were and have the societal acceptance to be who they are. And that's why it's not going up, going up, going on, going up. It's plateauing because there's going to be a certain percent of the population that is left-handed or is gay, right?
Yeah, I guess, but like, I'm just saying, I've never said that kids don't know who they are, but I'm just saying that childhood development is fluid and it's incomplete. So I don't think we should apply identity labels to children prematurely because that
So what
collapses
should
that
the education look
distinction.
like? It should be restrictive and not complete when
Education.
it comes to education?
What do you mean education? Education about gay people? I mean, why are kids learning about gay people and straight people? I don't think they should learn about either
What
one.
about child development being fluid? Do you not think that could benefit?
Wait,
Like
what
any
age
education about
range
who
are you
you
talking
are as a
about
person
children?
could be beneficial to your education or progression in your like psychology growing up?
Wait, what do you mean children? Do you mean like the age like, because by children I'm thinking you mean like between 0 and 11 or 0 and 12.
Sure. Yeah. I think that if you're learning in first grade, let's say, that like boys can be attracted to boys, because I was definitely aware that boys can be attracted to girls when I was learning about my parents showing affection. Like if you saw a family tree that had 2 boys on it, like 2 dads on it, you're learning about homosexuality. Do you think that's wrong?
I don't think it's wrong, but I don't think you should like be teaching about it. I think if you see it, that's fine, that's cool.
Why should it be restricted?
Ask your
Because I
question
can
again.
give you marketable
Ask your questions.
like evidence that it's beneficial. What's the harm?
I'm saying that I never got taught about, oh yeah, a man should be with a woman and a woman should be with a man. I never got taught about that. There's a
I
lot of
mean,
things
you
I never
did. It
got
just
taught about
wasn't as
that.
explicit.
They just saw it. Like you just see men and women together more than you see.
That's also
men and men
education.
together.
Education is visibility as well. Like
Hey,
you see things. I
aren't you
watched
letting me
videos that
talk?
were very educational.
Excuse me, why aren't you letting me talk, sir? Oh wait, I don't
It's a
know.
TikTok live. People interrupt. Go ahead.
Yeah, but I don't know why I'm being very respectful to you, so you don't have to do that to me. I'm sorry.
I feel like you're repeating your points, and I'm impatient.
I feel like acknowledging like that some gay adults do recall like having early feelings, but that doesn't mean that their identities were fixed at the time. Like
In order to
everything
make that
changes,
argument, you'd have to make an argument that it can be
damn,
changed.
again. Oh my fucking gosh. Oh my gosh. When I was in kindergarten, I was kissing girls only. Like I only like I swear to God, when I was in kindergarten, I was kissing girls. Now I'm engaged to like a man. Like
I mean, yeah, nobody's saying you're going to understand what those feelings are at that age or that those feelings are arising at those ages. But your argument is that, oh, it can change. That's the argument you just made by it being fixed.
I'm saying that at the same time, like refusing to label children doesn't deny like future outcomes or erase anybody's existence. It just recognizes that identity consolidates over time. If we don't label children as heterosexual, then we shouldn't label them as gay either. Like I don't hear
You
people
don't have to
saying,
take the
"Oh, my
label.
goodness,
We're just teaching what it is.
But you said, do you believe gay kids exist? You didn't say, do you believe that we should teach kids about gay kids? That wasn't your question.
The whole point was gay education is included in the curriculum when it comes
Was that
to
your
2
question?
fathers. That was my example, right? The whole example is that somebody can have 2 fathers.
I never heard you say that, and that was never your question. That was
literally the point I made about gayness being included in the curriculum. You said, well, at what age? And I gave first grade as an example to where gay education would be included through the family tree, where you'd learn that somebody in the class could have 2 fathers. You said you disagreed with that being in part of the education because why do kids need to learn about that? I feel like you understand the fluidity of education about sexuality, except when it comes to homosexuality or anything other than the hetero.
No, I'm not against homosexuality at all. Like, I'm not against it at all, but I'm saying that there's no reason for kids to be learning what gay and straight is when they're 9 years old. Like,
the whole point is development. The whole point is understanding affection in society. That's the whole point. Those feelings arise at those ages, so you should have some educational backing at those ages. That's the whole point. In 4th grade, I was experiencing like a little bit of sexual, mostly romantic attraction, but a little bit of sexual attraction because people develop at different ages. But like at those ages, people are experiencing that. They should have an education to back what they're feeling.
I don't really think that's not really necessary. Like, I didn't have that education. My friends didn't have that education, and we turned out perfectly fine. Like,
We did. You just don't call it that.
Literally, we didn't get sex ed until...
You didn't learn about princes and princesses?
We didn't get sex ed until 5th grade. Okay, now in 2025, kids are learning about princes and princesses. Like,
that's not a 2025 thing. That was like when I was a child. That was in like 19.
I said princes and princesses together.
Yeah, no, not princes and princes. Just princesses and princes is a part of education. It's a part of learning about English. It's about learning about romance growing up. If you look, I'm sorry, you are talking about the fluidity of education of children. I guarantee if you Google and look into any study about the importance of learning about sexuality at young ages, and that's not just intercourse, it's affection and romance. It is considered extremely beneficial to children's development understanding these topics. If you look into any of the psychology behind it, it is beneficial to understanding good behavior from bad behavior and normalizing those behaviors at younger ages that you can replicate when you're older. But it's still age appropriate. Like, I wasn't learning about intercourse in first grade, but I was learning about mothers and fathers showing affection, something I would see at home. So that can be normalized and you can understand it rather than like being confused or weirded out by it or like not understanding it, which can have harm.
But you keep saying like educational wise, like they're learning that in school. I mean, you might have learned it by your parents, but not everybody does. You're talking about school. I'm talking about a personal opinion where you said, do you believe gay kids exist? I said no. I said you should, like, they might exist. They probably do exist, but I don't think that you should label a child as gay or straight. Neither one.
Why? What is harmful about that label? It's just understanding attraction exists at those ages. And by the way, it's also an argument of predisposition. I was gay when I was 1 year old. Like 1 year old. I didn't, like, nothing about me changed. Just because you don't experience sexual attraction as an infant doesn't mean there's not that predisposition aspect, as this is part of who you are.
Is it my turn?
Sure.
Okay, so first, the people in the comments, I didn't mean to say 5th grade, because in 5th grade you just learn about like periods and stuff, but in like, I think it's 8th grade is when real sex ed happens and you start learning about actual sex. But okay, so anyways, I had to just clear that up because they're getting on my ass. But I just don't think that we should label them. I don't think there should be a label at all.
That didn't respond to anything that I said.
I don't
You just
think that it
repeated
should
your
be
initial
taught.
claim.
I'm saying I don't think it should be taught in school. Like, who cares?
That's your initial claim. Can you please respond to anything that I said?
Yeah, because you literally just said the same shit that you said. What are you talking about?
No, I actually made new points about how it's beneficial to like a child's psychology. Like,
it's beneficial to see gay people.
There's so much
like,
evidence in psychology that it's beneficial to your development as a child to understand healthy versus unhealthy behaviors and what should be replicated. Like, it's so beneficial to normalizing that and being a part of who you are. And also, if you're having those same feelings at those ages, having an understanding of it reduces insecurity, reduces the self-harm that could happen from like any anxiety around those feelings, or a lack of understanding could lead to you demonizing or like hating that part of yourself. That happens a lot of times when people don't have any awareness of who they are. Like, come on. I feel like we understand that in a concept when it comes to like cultural erasure, when it comes to like if there was religious erasure or anything, like you understand that like these aspects being erased from education can have implications on how you see those things in life, right? Education has an impact on socialization, an impact on how certain groups are treated in society. We understand that. And that has an impact on how you view yourself if you're a part of that group. That's like so clear to me.
I don't know what you mean though by like in education, because in education you don't ever learn like, oh yeah, a man goes with a woman or a woman goes with a man. You don't learn that.
I learned that.
That's how you make babies.
I learned women went with men at a young age.
How did you learn that?
I learned that my mom loves my dad. Women love men. I learned that princes love princes. I learned that romance was a thing in like first, second grade. You learn these concepts at extremely young ages, and it's an important part of socialization to understand healthy and unhealthy behaviors.
And I just told you that it's 2025 now, and there's gay people on like every single cartoon, literally every cartoon.
Great. So in the past, you would agree with LGBTQ education?
In the past, I was like 10 years old. What do you mean? I wouldn't agree on anything.
I'm asking if your argument is consistent. You say, well, it's everywhere now. So in 1998, would you agree with LGBTQ education for like, let's say third graders?
I wasn't alive in 1998.
Can you answer the question?
No,
yes or no?
I wasn't alive. No, because I wasn't alive. What do you mean?
What do you mean? Your position on whether education should include a topic is based on whether you're alive during that time period?
Do I think that they should have been learning about gay people that weren't really openly gay back then? I mean,
there were plenty of openly gay people in 1998.
There wasn't a lot of openly gay people, and there was a lot of stigma. There was a lot of stigma around gay people because of the AIDS pandemic.
Why are you scared to give me an answer to this question? I'm asking if your logic is consistent. Before there was the information of gay people in 2025, would your argument be the same? That was my question.
Yeah, it would be the same.
Great. So it's not about all the information that's available in 2025 about gay people being everywhere. It's not about the visibility aspect. You still think it's inappropriate. So don't use that as a scapegoat. That was my point.
I just said that I don't think kids should be taught about sexuality when they're a kid. They're a kid. If they're attracted to what they're attracted to, who cares? Who cares? It doesn't matter until you're like...
Let's do a little research together.
Oh my God, no. I don't feel like doing the statistic shit.
Yeah, because you don't care about the facts.
Because you asked an opinion-based question. Do you believe?
It's not opinion-based about whether it's beneficial to somebody's development. You said they don't need to learn about that. I said they did. I said there's psychological evidence to support that it is beneficial. You said, nah, they're kids though. That was your literal reply. So if I need to get into the evidence to back it to show you that your position of ignorance is dumb, then I will.
Are you drunk?
Yes, I'm still debating better than you. So keep up, babe.
I don't think so. I don't think so.
Then prove it, because I'm coming here with facts. You're coming here with opinions. You're coming here with rejections of facts without anything to back it up. I think that's weak.
I didn't reject any of your facts. I said that your question was, do you
I said it's beneficial to their development. You said, nah, they're children.
I said the question is, do you believe? Literally. You said an opinion.
Can you answer that? I'll say it as many times as it takes for you to answer it. I said that it is beneficial to their development. And there's a lot of psychological evidence to support that it's beneficial to their development. And your response was, nah, but they're kids. So do you actually have any evidence in support that it's not beneficial or that it's harmful? Because I have evidence that it's beneficial and should be included.
I don't think that it should be included unless my child comes to me and says, hey, mom, I think I like, or unless my son comes up to me and he's like, I think I like boys, mom, then I would tell him about it. But if he doesn't care, then why would he need to know?
Because it's beneficial to their development, and I provided evidence for that.
It's a new time.
You just don't care about that. You don't care about the benefits.
Nobody's going to question it. If their parents don't teach them to hate gay people, then no one cares. Or if their parents
only teaching about straight people teaches you to dislike or other gay people. I hate to break it to you. If you only learn about people with brown hair, then you might ostracize people in society with blonde hair or red hair. If you only learn about people with blue eyes, then you might ostracize people with green or brown eyes or hazel eyes. If you only learn about people with one skin color, you might ostracize or discriminate against people with different skin colors. Education influences societal opinion. We know this, and it cannot be erased just because you consider some exclusion of education appropriate. Your exclusion has intention behind it that is societally influenced by this argument of grooming or inappropriate material being attached to my existence.
To your existence. I literally just, oh my gosh. You are such a victim. That's why I don't understand.
It's not about being a victim. It's about the facts. It's about the facts that people associate my existence as an inappropriate topic that should not be around children. That is inherently demonizing or making the entire existence inappropriate. I'm sorry, that's the facts. The facts don't agree with your feelings about it, Solo. I'm just providing the facts.
But you asked an opinion-based question. But anyways, you said that if we don't learn about gay people, then basically kids are going to think gay people are weird. Did you learn about people from Finland when you were in school? Because I didn't.
From where?
From Finland and Switzerland. But I
learned about people from different countries and that other people have different cultures, and you should have a certain level of respect for that.
I'm not insulting him at all. Ben Volio. I don't even know you. Anyways. No, my whole entire point is there's no reason.
I gave you a direct response and you didn't even hear it.
I came here to argue about, do you believe gay kids exist? My answer was
Can you respond to what I just said to your specific argument rather than going to a general claim again? Stop running from your own argumentation. You're making a point, I replied to it, and then you're scared of that point.
No, nigga. Your first question
Then respond to it.
Believe gay kids exist? I said no.
Respond to your specific point. Why are you switching up?
No, I'm not switching up at all. Do I believe
your specific point was, did you learn about people in Finland? And I had a response to that. Why are you scared to respond to that?
Oh, yeah, I said, so now do you, if you didn't learn about people in Finland, because I didn't, I don't think that Finnish people are weird now. You just said that.
No, that's because you learn about people in different countries that have different cultures. You're supposed to learn that people are different so you don't ostracize people that are different.
Oh my gosh. Okay, let me think of another example. I'm sorry.
Because it doesn't agree with your narrative and it only proves my point. Thank you.
No.
Because it agrees with my perspective.
No, I just gave you
that if you do not learn about people with different cultures, you're more likely to be disrespectful towards people with different cultures, right?
I've never learned about Finnish culture. Sorry. I'm sorry.
Okay, different cultures as a concept doesn't mean you have to learn about every single culture in order to understand a level of respect for people with different cultures. Oh my God. I feel like that's such a simple concept.
Literally, the only cultures we learned about in school were Native Americans, Hispanic people.
Okay, stop ignoring my point. You just ignore my point. Learning that people have different cultures inherently makes you more prepared for people with different cultures. You don't have to learn about every single culture to have a mindset of being inherently respectful of people with different cultures. And you're ignoring that. Can you respond to that?
We didn't learn about African people in school at all in
Okay.
high school. And now it's like
You're
we still
not
keep the
getting
African
it.
flag.
Why aren't you getting it?
What do you mean?
I'm repeating the same point because you're ignoring the same point.
No, you're
Okay,
saying
maybe
dumb
if I
shit.
learn that I should be
Asking
respectful
consistent
towards people with
questions.
different cultures, it doesn't matter if they're Finnish or if they're Mexican or if they're from England or if they're from Japan. Maybe I'll have that mindset in going into an interaction with them
I'll be
that
like,
maybe I should
yeah,
have a
I'm getting
respect towards other people's culture and I should be respectful towards them because they might have a different culture. You're ignoring that. Stop ignoring that. I made the point so that you prepared for culture, period. Not every single specific culture. The idea that people have different cultures. So if you're not learning about every single culture, but you're learning about the idea that people have different cultures, you can be prepared for that and more likely to be less ostracizing or hateful towards that group. Like I learned about immigrants. I didn't have to learn about where specifically these individuals were coming from to understand that there is discrimination in this country against immigrants. So maybe I can have a certain level of understanding when it comes to immigrants that I might not have had if I didn't have that
Wait, no,
education.
there's too many gay people in here. I don't even want to argue anymore. They're getting on my fucking nerves.
Run away.
Oh my gosh.
Fuck
Total
off, girl.
faggot.
Fuck off and
Shut
cope.
up, fat bitch.
Cunt. Girl, I don't care. I'm so over that shit. Cope because you have no facts. You have no information. You have no evidence, no arguments. Because every time I disprove you, you just run to something else. Frankie, you're not ops. You're coming in here to do an assist. I don't need an assist. I eat on my own. I'm big enough for that. You're ops? Send me this recording. Why? Okay, I'm trying to get some more ops in here. I'm not gonna be up here no long. I'm not gonna be up here long. It's too gay in here. I get that you don't want to debate, Kay, but you're just gonna say something for a while and then it's gonna be a while until I get the next guest in. I'm trying to get some more ops in here. Can you not comment what you want to say and I can just say it? Oh my God, Kay. Don't be long.
Send me this recording because I'm going to send this to every medical school in Texas.
Why? Because she works at one?
She says she's trying to attend medical school, and that right there, what she just did, does not showcase cultural competence and does not, goes against a lot of medical practices because it's implicit bias. And she's in Texas, so I know all the ones in Texas because I was going to apply for them.
Also,
You're
not
not
her
there.
still in the
Also,
comments.
Solo,
I thought
you're
it was
not
too gay
there.
in here for you. Boo.
Girl, you're a liar. You're not there already. Because if you took the MCAT, you would have knew about cultural competence and what this person is speaking on implicit bias. And it actually talks about and measures implicit bias not only in the MCAT but also in the review. As someone who's going to attend medical school, you're simply a liar. But yeah, that's all I gotta say. Send me this. I'ma need that.
Girl, I love you. Adrian, are you op? I'm trying to get some ops in here. I feel like Adrian was agreeing with me. Frankie, are you op? You said you were op and then you said JK. So are you op or not? You want to ask what I think about birthing person? I can just tell you now. Birthing person is just an inclusive term that is about understanding that it's not just females that can give birth, or women, right? Because trans men can give birth, and also intersex people can give birth, depending. But specifically when it comes to that, it's just saying like, well, it's not just women, because we consider trans men men, and some trans men can give birth. So what's the issue with using a term that's more inclusive rather than just only women can give birth, when that's not the belief? Trans men can give birth, trans men are men. It's just understanding language. Okay, Frankie, you have 2 minutes. Tell them Solo from class of 2026. She wants all this.
Oh my gosh,
comments.
thank you so much.
You're on thin ice, diva. What's your point?
I'm sorry, I love you. I want you to know you were fighting the good fight.
Okay,
And
thanks, bye. Girl, ops only. I can't with y'all. Thank you, Ringy.
Thank you so much for letting me up here. I have so much to say.
Are you an op?
Yes, but I'm gonna be respectful. I promise. I promise.
You don't need to be.
Because I know. Well, I know you're drunk right now, and I don't want to get like on your nerves. Okay.
You're good.
I'm triggered over the term birthing person because, as a woman, I feel like women deserve the title whenever they are giving birth to be a she and a female because periods are freaking brutal. Periods are evil. Menopause, freaking brutal. Evil, okay? So I feel like women should deserve the title of she instead of a birthing person because she's a woman. She went through that.
Wait, they're still going to refer to you as she. It's not birthing person, so you have to refer to every person that gives birth as they and them. Like, trans men who give birth are still going to be called he and him, but trans men can't give birth, right?
Why would
So they're still going to call you she and her just when they're referring to pregnant people. It's not just women if we consider trans men men.
Wait, okay, but why would trans men want to give birth if they're identifying as a man?
Because people can still want that experience. I mean, like, you can still want that experience. I feel like
be more in tune with the experience of being a man if you are a trans man and you want to be a man. Because that kind of comes
Wait,
with
what?
wanting to be a man. Well,
if you have the ability in your body to give birth, I feel like whether you're a man or a woman, a lot of people would want to use it. I'm not gonna lie.
I'm wondering, because as a woman, there are certain traits, and as a male, there are certain traits. So, like, why would a man or a woman transitioning over to a man not want to hold all of the men's traits and completely discard the woman aspect of things? If you are not comfortable being a woman and in your body and you're wanting to be a man,
well, I'm sure a lot of people would have issue with that, and a lot of people wouldn't want to give birth for that reason. But it's individual. Different people have different levels of gender affirmation, and not everybody needs to have that same view of gender affirmation. Like, it's not 100% man, 100% woman. It is a spectrum, and people fall in different places on that. So if people have certain desires when it comes to giving birth, and that's something they want, but they still see themselves as the other gender, then that's them. That's their own life, and that's how they see themselves in their own expression.
Okay, real. I understand that. Completely agree there. Personally, I just wouldn't want to be called a birthing person. I'd want to be called a woman.
Okay, do you also have an issue with being called cis? Like, I literally tried to comment cis on Twitter today, and they literally said, do you want to post this? It contains offensive content. I was like, really?
Okay, so I think my only thing is if someone calls me they. I stand so strong in being a woman personally that I'm like, okay, I am a woman. My boobs are freaking obnoxious. Do not call me they. Like, and that's a personal thing. It's not about anyone else. You know, if somebody calls somebody cis because they're trying to be respectful of everyone, that's fine. Just not me.
Okay, why does cis offend you then? Because, you know, if you're in a conversation, you're talking about cis and non-cis people, we wouldn't have to have the word cis if the only default language for non-cis people wasn't normal or real. Because you've had those discussions. Well, there's trans women, and then there's like real women. Well, there's trans women, and then there's biological women. And then there's trans women, and there's like, well, normal women. It's just like there's so much language centered around that. It's just like, there's just a classifier. It's saying the same. So when it comes to cis, it's just your gender identity is the same as your sex. So I don't see anything wrong with having a term for non-trans people rather than just saying non-trans.
I just call people what they go by. I'm gonna be so for real.
And a lot of people, if you don't want to be called cis, they'll respect that unless you have an intention behind it of like invalidating trans people. They're just like, well, can you not call me cis or something? Because like a lot of people that are trans women will recognize that they're trans, but don't want to be called a trans woman every time. If you just want to call them a woman, or you just call them by their name, like that's fine. Or if you don't want to bring it up in conversation, like that's fine. There's a certain level of respect you can give to people on how they want to be identified, but it doesn't make the classification incorrect. And I'm saying with this whole cis identity, I don't understand why people are offended by it, because if anything, they're so like feverishly trying to differentiate themselves from trans women. I think they would like a term that would actually differentiate themselves from trans women.
No, real. Like, I think the only thing with, like, being called a cis woman, I'm like, I don't know. I'm just a woman, and trans women are women. Like, it's
Yeah, but you understand that it's only when it's relevant too. That's typically when it's brought up. Like if you're having a conversation and you're like, "Well, I have a lot of women friends," and then somebody asks, "Well, are any of them trans?" And you can say, "Well, yeah, I have a couple of trans friends, like couple of trans women that are my friends, and a couple of cis women that are my friends." It's literally just how you differentiate, and it's how it's like appropriate in language to make those differentiations, and it's not going to be brought up every time you talk about them. Just like I could be Homo erectus, bitch. It's not like it comes up in conversation. Like it's only when it's specifically about that. So if you're talking about trans people, then you might use the term cis because you're differentiating trans from cis people.
I feel like the only reason that it was saying that it was probably going to be offensive is because these freaking AI monitoring systems, like, I don't even know what's going on right now. Videos getting taken down and stuff, creators being banned for random things that have nothing to do with
That's always been happening. Don't blame AI for that. That's always been happening.
No, what? Are you serious?
Is it on the rise?
People just randomly getting banned for the most random shit in the world. That's not AI.
That's always happened. People always claim that they just got banned for random shit. That's just like shitty algorithms in poor keep up.
Oh my gosh. That's ridiculous. Okay.
Okay, do you know how many times I claimed I was banned for no reason and it wasn't AI, it was an algorithm?
So wait.
Are you saying you never got banned wrongly, like before AI? Like, I'm sorry, anybody who's had a public platform understands that they got banned wrongly on like almost every social media platform for having public, like political takes specifically as well.
I didn't know that it was an algorithm thing. I thought that there were people behind monitoring systems that were going through things.
I mean, there's supposed to be, but there's just not enough. There's like so many millions of people on the internet.
Oh, I see. That was a blonde thing. I'm sorry.
You're good. But is there something else you disagreed with? Because I feel like a lot of people just have an ego issue when it comes to these terms because they think that having a prefix to an identifier takes away the validity of that identifier. It's like, well, you're just a human. You're not a Homo erectus human. You're just a human. It's just like, well, why do you care about having a prefix there that's only used when it's relevant?
I just kind of like personally, I just feel like it's somebody calling a human a Homo sapien. Like, it's the same thing.
What if somebody said, don't call me a man, just call me like my name. Just call me who my name is. Never call me a man. Would you not think it's weird that they're uncomfortable with being called a man? Like, it's also who they are.
I think they're having some identity problems. I think that they're probably like...
Then I think somebody who is uncomfortable with being called cis might have an identity problem.
Wait. Yeah, that makes sense. Okay, agreed. Now, I'm gonna, because this is the topic that I'm strong about, like these two at the top, the do you believe trans kids and gay kids exist, because these are the topics that I have like personal experience with that I wanted to come up here and talk to you about, because it's like, oh, okay. Hold on.
There's only one more request. We're going to move on in a second.
Sorry, Diva. My sister came in.
All good. I only have one more request, and I really need to head out because it's almost 3 a.m. So I appreciate you coming up and being respectful, though.
Wait.
Any final thoughts?
Am I out now? Because I wanted to talk to you about this.
You folded on, like, all of your arguments. What else is there to talk about?
No, okay. So the trans kid and gay kids arguments, because I have experience with it. I believe that, people...
Personal experience or statistical evidence-based experience?
Personal-based experience.
Okay, well, a lot of people claim to see gods I don't believe in, so sorry if I take it with a grain of salt.
No, that's... I'm not talking about that. I'm talking about personal development over the years. Between going on and off. I personally believe that everybody should not make very strong decisions about their lives until they are 25 and they have full mental development and they have full knowledge and everything. I believe that it should be taught more and that everybody should know a lot of things about what they're doing, but they shouldn't make very strong decisions about like things they're taking or things that they're like, you know.
Okay, is this specifically for trans kids or gay kids?
It's for the things that they're taking. It's specifically for trans kids. For gay kids, it's like making those strong decisions about who you want to be with, who you like, because I have personally been...
Okay, I'm sorry, but straight kids literally start dating in 2nd grade, and it's like holding hands on the swings. Like people, I think it's a healthy part of understanding relationships to have.
I'm talking about sex.
Well, yeah, of course. That's why there's a legal age of consent.
Yeah, exactly.
Do you want to raise the legal age of consent to 25?
Well, I mean, you shouldn't really have the full... the full identity classification of anything until you are 25 and you have that full knowledge, because reputation-wise and physically wise, you shouldn't hold yourself to a label. Or
okay, a label is different than your existence. You don't have to define it, but learning that these labels exist in society, just like I learned about a bunch of religions I didn't understand, but I learned that those religions existed in society as a concept. Like, it's still good to know these things. It's still good to have an understanding of how society works.
Have that education. People should know, and they should know everything about everything. Do
you not think learning about the labels and learning about the existence also helps you understand those feelings and understand it as a concept first?
What?
It's like explain blue without talking about without using the word blue, because I feel like you're trying to like, well, I want them to understand these concepts. I want them to have this development, but you shouldn't use these labels. I'm like, how do you understand it without using these labels? It's not like you have to self-identify at 3rd grade and it's just like every kid identify straight, bi, pan. It's like right now. No, it's just like understand that like people with certain attractions exist in society.
Mm-hmm. In middle school, from 6th grade all the way up until high school, freshman year, I thought I was gay. I thought that I was attracted to women because I had a lot of personal issues with men and the comfort of being in a relationship with guys, because guys, everybody is rapidly developing with their hormones and it's kind of all over the place, right? So during that time period, I thought I was solely attracted to women, but I'm not attracted to women at all now. And I feel like over time, personally developing, like even in my mind, just solely focused on myself, I've discovered that I'm not gay. And I feel like a lot of people are deciding those things at a young age and they're changing themselves as a person into someone else instead of just solely coming up with that themselves.
Okay, but this is also like a part of self-discovery. Are you saying that because you experienced that, it influenced your sexuality? Or are you saying that, well, I experimented and I discovered my sexuality through that experimentation of finding out what I liked and didn't like?
Experimented, I guess, but it still like I'm terrible at explaining things. I apologize.
You're good. And I would say it's different for individuals and it can be influenced by societal factors on how you view these things, which could influence how safe you are experimenting, right? Like if you're in a much more liberal area, there's probably going to be a lot more people experimenting with the same sex. Where if you're in like a more conservative area, you're probably not going to be doing that experimenting out of fear of your peers' judgment or self-judgment from internalized homophobia. So I think that like, yeah, there's going to be influences on how you view these things and at what rate you have this self-discovery. I think education can help that rate. Mm-hmm. And I think that awareness and experimentation can help that rate as long as it's at age appropriate levels. And I think that it's not making decisions about who you're going to be with at that age. I think it's making decisions to experiment and get out there to understand what you feel. Because some people understand it at young ages and they kind of got it figured out. Like I feel like I had it figured out around like 5th grade. like fourth, fifth grade, I pretty much understood everything about my sexuality, and it has not changed at all. Most of it was just like the societal aspect. But like for some people, it's a little later. Some people need to like experiment first, and that's okay.
Yeah,
But
I
like,
think
it doesn't
my
change their sexuality.
I've just noticed in my personal experience in middle school and high school that a lot of people, right now, it's really being pushed on people instead of giving people room to discover. And I feel like it should be an equal education level, so people that they aren't put labels on
As
them
much
by
as you want to
society
say
and
it's
things like
pushed
that.
on people, heterosexuality is still pushed so much more. So much more. If you're going to say, like, oh, well, seeing it in media could be influential, 99% of media is still heterosexual. 99% of the narrative about, like, sexuality is still overwhelmingly heterosexual and, like, cisgendered. If you look up the rates of people, well, is homosexuality or is homosexuality or transgenderism morally okay in society? It's lowering, and it's like at what, 85%? Those questions are never asked about heterosexuality or cisgenderism. It's never asked about that because it's never thought to be wrong. That's my point.
Okay. So your point isn't necessarily do these people exist? It's do these people have room to be acknowledged?
Well, it's also that they exist. I think it's just facts that we exist, and also you should be learning things that are appropriate at like relevant ages. Like I was learning about the family tree at ages where I was understanding that parents show affection and that you have brothers and sisters, and starting to understand those concepts of like an extended family. At those ages, it's like relevant. And then when you're learning about princes and princesses, you're also having some romantic feelings that you're seeing in society that should be having some baseline education about. So I think it's like when you're talking about like any predisposition or understanding of who you are growing up, I feel like the overwhelming evidence shows that the more education you have at age appropriate levels about these feelings that are arising, the more smooth your transition into understanding yourself is going to be. But if there's conflicting messages about like, oh, well, that shit might be demonic, that shit might be wrong or gross from your peers, you're much more likely to deny any discovery or information about these topics.
Real. People do need a lot more education on both topics. I mean, they need equal education there because a lot of children with gay parents get bullied. Children with personal feelings get bullied, and I feel like a lot of that just has a lot to do with development. And I agree a lot with what Solo said last time about children not having labels, because it's very important for people to develop themselves first and kind of grow into themselves as a person. So it's hard to kind of put those labels on children. And
I feel like this is just like, it's not proving the point you think it's proving. I feel like you need to look into some of these parents who are supportive of their kids when they want to dress differently going to school. There's this idea that like, well, I can tell them that everyone around you is going to be a bully and you should hide that part about yourself because you don't want to have this negative experience in public. And the overwhelming evidence shows that that's just like so damaging to their mental health and the insecurities they'll develop and the therapy they'll need years down the line, to where it's like, you'd much rather give them the freedom to be who they are and help them tackle the negative aspects that come with being who you are publicly in a less accepting society. So I feel like that's like kind of the evidence that these labels can help their mental health and their self-discovery rather than hurt it, which is only fed by suppression, which is kind of the whole no labels argument is, well, yeah, you don't know, so hide it. You don't know, so don't label it. You don't know, so
oh
don't
no,
talk
that's
about it
not
as
what I'm
much.
saying.
I feel like it is hiding it if you're not supposed to
No.
put those labels on it. It's just like, well,
I'm
you
saying
might
that
be, who
people
knows, who
need
cares,
room
don't
to
say it
discover who
though.
they are. I'm saying that people need room to discover who they are before they put things on themselves that they don't know. Like, even straight relationships, putting yourself into a situation where you're like, oh, I'm fully straight, and then you find yourself attracted to another person, and you're like, oh, I'm not. People have fluidity as children, so they don't need to be putting themselves
But
in
labels
certain
can
positions.
change. What's wrong with having a label and it changing? I mean, like, people can have different career paths. People can have different passions. You can be like, well, I'm an artist. Or the next day, like, I'm a gamer or whatever. It's just like, it's not your desires changing. It's your understanding of your desires changing, right?
Yeah.
Like, you can only eat certain
25.
I've discovered today that I'm not good at arguing.
You're fine. I feel like your points are at least genuine, so you're good.
Okay. Thank you. Have an amazing night. You gave me a lot of insight on things.
W. Appreciate it.
Yeah. Clock it. All right.
All right, have a good night.
Good night. Bye.
All right, I have time for one more. So the next person that accepts is the last. Nope. Nope.
Hello?
Hi, how are you?
Yeah, I'm good.
What topic do you want to talk about? I also have another background that I might go to.
We could go with the first one. I don't believe that trans can exist.
Why?
Because I don't believe it's something that's inherently built in within humans. And I don't believe it's healthy for kids to transition either.
When do you think it comes about? When do you think it develops? And why do you think it develops?
Wait, what was the question?
If it's not predisposed, when do you think it develops? And why?
Well, I don't think it's this thing that develops. I think it's built on from gender dysphoria, and because we live in a society where it's accepted, people do it. And
Do you believe trans
I don't
people
mind
exist
people
as a
doing it 'cause-
whole? Or because I feel like this is another person saying, oh, well, it's not that trans kids don't exist, trans people don't exist. Which it's not the point of the claim. The claim is people who believe in trans adults, but not trans kids.
Well, I believe people as adults transition, so that type of thing exists. But I don't believe that
Understanding that people transition is not saying trans people exist. If your whole competing claim against trans kids existing is that it's not a real thing and it's just onset from gender dysphoria.
Yeah, that's my claim. It's onset from gender dysphoria. I don't know what you mean by exist, because there's obviously trans people. What I mean by exist is that it's not something inherent within human. It's not like biologically built within humans. So that's what I mean when I say it don't exist.
Okay, so you're saying it's onset from gender dysphoria. How do you know that it's onset from gender dysphoria and that it's not like a gender dysphoria is a byproduct of being trans?
Because people who transition always struggle with gender dysphoria prior to transitioning. And secondly, I don't see any evidence that suggests that it's plausible that being trans is something that's biologically built within humans.
So you don't have evidence for it, so you're assuming a different claim is true.
I'm saying I haven't seen any evidence at all that makes it appear that it's plausible that trans is something that's biologically built within humans.
I would say that we have a lot of evidence that people say that they were very sure of their identity and that they were different than the norm when it comes to gender identity at extremely early ages, as soon as they're understanding gender and as soon as they're understanding themselves. And I feel like it draws a big parallel to like sexuality and understanding that aspect of yourself as well. A lot of people report similar things at early ages, which leads us to believe in this idea of predisposition. And there's no evidence to support that it just comes about one day and that you can change it. So I feel like the inability to change somebody's gender and somebody's sexuality supports the idea that is predisposed.
Yeah, well, if that was the case, the statistics would be different, but it's
How?
not, because the statistics I've seen suggest that there's no long-term benefits when it comes to transitioning. So if it was the case that
There's
it was
so much evidence to
natural,
support that there are long-term benefits of the trans people that exist as adults, because the life expectancy is a lot lower for obvious reasons. There are definitely benefits. There's more alignment with their like expression, whether it comes to like their body or their voice or their appearance, like, or how they're seen in society. There's so much more cohesion, and that causes extreme rates of lowering when it comes to suicidality or when it comes to other negative mental health aspects. Those are definitely helped in all the evidence we've seen.
yeah, those are all short-term benefits. The issue is that
there are longer term.
Hang on. The careful study shows that, like, I can show you the study that was out in 2019, but then it was corrected a year after, and then experts said that there was no clear benefits long-term speaking, meaning that there is short-term benefits. However, the issues that they had prior to those short-term benefits actually come back within 10 years. And the source is the American Journal of Psychiatry.
Are you just talking about gender dysphoria? What are you talking about specifically?
Just transitioning. When you transition, there are short-term benefits, but then those issues all come back long-term speaking.
What issues?
Specifically in 10 years.
Okay, so what? Just something bad. Boo! Scary. Something bad will come back in 10 years. We just don't know what. Something. No, look out for that, y'all.
All those mental issues that they had prior to transitioning comes back, actually. So they're going to be the same way. And that's why it's not something that's naturally built in or is biological.
No, everything I've seen says their suicidality goes down. It's not coming back. I don't see any support of that.
It goes down short-term speaking, not long-term.
I don't see any evidence for that.
I just gave you a source.
Repeat it.
It's the American Journal of Psychiatry. Wait, let me pull it up on my thing. The title is Correction of a Key Study, No Evidence of Gender-Affirming Surgeries Improving Mental Health.
The data presented in the original study and the subsequent reanalysis do not support the claim of an expected reduction in mental health treatment as a function of time since completing such treatment. I don't know what that means. Reduction in mental health treatment as a function of time? We conclude the following. The mental health needs of people suffering from gender dysphoria are significantly greater than those of the general population, which confirms previous research. No mental health benefit of hormonal interventions was demonstrated. No mental health benefit of gender-affirming surgery was demonstrated. Specific to the question of longitudinal association between time from surgery and mental health outcomes due to unaddressed study design limitations, No improvement of mental health with time after surgery was demonstrated, despite the higher rate of suicide attempts requiring hospitalization in the surgery group. The study design precludes the assertion that gender-affirming surgery is harmful.
And then there are also other studies which talks about the suicide rate among the trans people, which is like more than half, which is kind of insane. And also the suicidal thoughts among these people. So just to ask you a question, it would be, if there's no long-term
See what the
benefit,
evidence they have for this is, though. Hold on.
American School of Psychiatry, and also it's an institution in Sweden, and a bunch of experts.
What is that? I'm seeing a lot of things quoting this, but not a lot of evidence backing it. I'm trying to see specifically about it.
There's
One study published in Pediatrics found that transgender adults who had received pubertal suppression and hormone therapy as adolescents were less likely to experience lifetime suicidal ideation. A study in the Journal of Adolescent Health found that transgender and non-binary youth receiving hormone therapy had nearly 40% lower odds of recent depression and past year suicide attempts. Research from Harvard T.H. Chan School of Public Health indicated that gender-affirming surgeries were associated with a 44% reduction in ideation when compared to individuals who did not have surgery but desired it. The role of social support, non-medical forms of affirmation also play a critical role in S prevention. Youth whose families use their chosen names reported less S ideation. Across the board, support with family, friends, and school professionals is associated with significantly lower odds. That was like one study I saw specifically. I don't have it right now, but it was, 70% reduction in S ideation when it comes to having one supportive parent in the household. I feel like the support system you have is much more influential about the mental health of a transgender individual. And you also have to recognize when transgender people transition, they are more publicly trans. Whether it's social or medical, there is more affirmation that you are trans in a public space, which especially in 2025, or not especially, but like there's always been some shade. Trans individuals experience so much more hate when they are publicly trans rather than DL or hiding. And I think that has to be taken into account when it comes into those influences.
That's fine, but the same argument can be used for any sort of minority or anything that sets you apart from the majority, I feel. And if that was entirely the case, the short-term benefits wouldn't be so evident, and then it wouldn't go away long-term speaking. It's not like people change their behavior, they're nice to you at first, and they're just get mean to you long-term speaking, and then your issue just magically appear again. It more so has to do with the fact that when you get these transitioning, you tell yourself something, and then long-term, you realize you're not that thing. You realize that when you tell yourself these things and then you believe them.
Hey, stop yapping. Stop trying to tie in other points to this already dumb point that you made.
It's not. You haven't refuted
It is
it.
a dumb. Stop yapping about it. You're trying to tie in a million other points. Let me respond to the shit you said. Damn.
You haven't refuted it, so why are you calling it dumb?
Calm down, okay? I just don't want you to yap on other points, trying to make a whole monologue out of it.
I wasn't even
It's very clear. It's very clear that if me as a feminine man was on a public train system and I was next to a transgender individual who was, let's say, a trans woman, where they're wearing a skirt or a dress or anything like that, or a wig or anything like that, you know that they would be much more likely, especially if they're not passing, they would be much more likely to be harassed on that train than I am as a feminine man. Even if I was trans DL, I would not be the person targeted in that specific area. So it's not about them denying who they are or anything like that, because if that was the case, then we would be treating gender dysphoria the same way we treat schizophrenia, which is just deny, deny, deny. But all the evidence supports that just increases suicidal ideation and increases gender dysphoria and increases mental harm. So that's not the treatment. So your solution of saying, well, you're actually just delusional, crazy people who should just be the gender you're born at birth. Like, that's not the solution that you're trying to paint it as. There's so much statistical harm towards that. So that was a dumb point to bring up. And two, I don't know why you're trying to ignore the fact that people who are publicly trans rather than DL experience so much more hate, and that plays into the depression rates, the temporary detransitioning, and the amount of the unaliving rates that happen.
So if it was the case that harassment was the main driver of these issues, then suicide rate, by your logic, should drop very high in environments that are more acceptance, but that's not the case. Post-transitioning people have similar suicide rate than the general population. And just to add on to that, people with gender dysphoria itself is a severe psychological distress. The suicide rate is not high from bullying alone.
Studies consistently show that transgender people living in potentially conservative or red states, particularly those with anti-transgender laws, experience significantly higher rates of suicidal ideation and attempts compared to those in blue states or those without such legislation.
Sorry, could you repeat that?
Studies consistently show that transgender people living in politically conservative or red states, particularly those with anti-transgender laws, experience significantly higher rates of suicidal ideation and attempts compared to those in blue states or those without such legislation.
What's your source, please?
The Trevor Project specifically found that states that passed anti-transgender laws saw an increase in past year suicide attempts among transgender and non-binary young people. In the years following these enactments of these laws, suicide attempts increased as much as 72% for those ages 13 to 17. The mere introduction of legislation did not have the same impact. It was the passage into law that fueled the spikes in attempts, suggesting that these laws signal a broader societal rejection of their identities.
Okay, well, let me check this out. Just give me 1 minute.
I think it's pretty, I'm sorry, I hate to invoke it, but common sense that if you are bullied more for who you are, you're more likely to unalive yourself. And if you're of a group that is bullied more than other groups, you are more likely to have this mental harm that can lead to suicidal ideation. I don't think that's a radical thought.
Just 1 second.
Like, I see your source, and I don't know, like, specifically the methodology behind it, but it seemed like it came to the result that you said it came to. I've just seen so much to the contrary when it comes to the benefits of social transition towards people who are trans and medical transition to people who desire it. The source doesn't mention his claim literally at all. I feel like it did in the conclusion at the end when it was talking about it says the SEGM position and that aspect of it. SEGM.org, AJP correction 2020. It's the Society for Evidence-Based Gender Medicine. Evidence-based gender medicine seems interesting. Okay.
So the source that you gave me, it's online self-reported surveys.
How else are you going to report wellness of people that are doing this? Like, that's
Well,
what you do when it comes to mental
the
health. It's just
issue
what
is
people are
that
saying.
the samples might overrepresent youth that are already in crisis because these people already have gender dysphoria to begin with,
What
and
is yours based on?
the issue is there's no direct correlation between suicide and bullying. When it comes to this, there's other factors that weigh in this, and then you're acting like it's that simple. It's not. It's very the way that suicide with trans people works. It's represented very equally across all states. It's not like there's radical suicide rates in one state and there's not in another state. This entire source that you gave me, it's bullshit. It's one of the way that it's done, the way that the title is so like misleading.
Hold on, let's see it. What specifically about it is, where are you seeing this? That it's like faulty? Because it's based on reporting? That's like your only issue with it?
Yeah, not just that, it's also the fact that it doesn't take into account that suicide attempts are not just doesn't just spring from one variable. There's like a lot of things that it's influenced by, and it doesn't take into the fact that these people are already struggling from gender dysphoria, meaning that they already are suicidal to begin with. And when you're taking online samples, obviously it's already youth that are in crisis. They're going to tell you they feel suicidal. And also the title is very misleading. When it comes to suicide with trans people, it's represented very equally across all states because all these people struggle with gender dysphoria. There's no radical improvement or there's no improvement or not or like decline in their well-being according to
45% of
suicidal
transgender
behavior.
and non-binary young people reported that they or their family have considered moving to a different state because of LGBTQ related politics and laws. Like literally trying to avoid legal discrimination for who they are. Do you not think that would be impactful on their mental health?
Obviously, but I wouldn't say that people being mean to you is the reason you want to unalive yourself. I think people get bullied all the time.
What?
It's
Do you not think people
it's
who
just a
are
lazy
bullied for
argument.
who they are more likely to self-unalive?
People being bullied for who they are, they want to.
Do you think
It
people who are
depends.
bullied are statistically more likely to self-unalive than people who are not bullied? And do you think that might have anything to do with people being mean to you?
Yeah, of course, but this doesn't apply to trans people because trans
You
people
literally just made the claim that people being mean to you doesn't mean you're going to self-unalive. Like it literally is pretty
because that's your
proportional.
argument. Because that's your argument. You're saying that trans people, half of them want to unalive themselves because people are being mean to them, which is insane. Because you're acting like
No,
this one
people
variable.
are insane towards trans people, and
The
trans
issue
people are
is-
reacting.
No, the issue is you're making it look like that this one variable is the reason why half of these people want to unalive themselves. Like, do you not think any other minorities get bullied? Do you not think
We're
Mexicans
looking at what
got
they're
bullied?
telling
Do
helps
you not
and
think gay
hurts
people get
based on the
bullied?
therapy and the reporting that they give. We're going off the information we have, which of course reporting is a pretty weak source when it comes to specific studies, but it's the only source when it comes to people reporting their mental health.
Right, because the source that you gave me doesn't prove that anti-trans laws cause suicide. It only shows a statistical
Actually, it's
association.
pretty strong.
You
It's a
haven't even
pretty
let
strong
me-
argument.
you haven't
People
even let me finish
moving
my
to get into
sentence.
better legislational areas
It
to
only
avoid
shows
discriminatory legislation. That's
It only
pretty strong
shows-
evidence that
it only
there's a
shows a
clear line
statistical
between mental health harm and
why are you
legislation.
filibustering? Can you calm down? It
You're
only shows.
filibustering. You're saying the same shit over and over again. I'm showing
I'm
you
not.
evidence.
Your evidence is very.
What is your evidence to the contrary?
Hang on. It only shows a statistical association following the passage of those laws. These data are, I told you, they're based on self-reported online surveys. They're not experimented, which means they can rule other factors like pre-existing mental health conditions, their gender dysphoria, their mental instabilities, and suicide is not one
Oh,
variable.
you're saying, you
It's
keep
very
repeating
complex.
yourself. You've already said this. You've already said that they're weak because
They're
they're based on
refuted.
reporting and they're not accounting for other factors. You've said that already.
But you haven't refuted it, which is why I have to repeat myself
I
again.
said that it's, of course, surveys are a weaker form of statistic, but they are still relevant in a lot of mental health fields in the way that people report their mental health and what specifically impacts it. These are youth that are trans that are telling you, this is what hurt my mental health. This is what hurt it. This is what is causing me to have more suicidal ideation or self-harm thoughts. And you're just being like, nah, actually, because it's based on like reporting and it doesn't account for like other pre-existing mental health conditions, that like all of y'all are what, lying, that I can't take anything you say with credence, that I can have no reliability in what you are saying about your mental health. That
No,
seems like
I'm
a
not
dumb
saying.
that seems like a really dumb refutation of my argument.
No, I'm not saying that bullying doesn't cause suicide. I'm not saying not one of the factors, but but the way you're arguing this, you're assuming that hostile laws are the primary driver in suicide. But if that was the case, suicide risk would sharply decline in highly accepting environments or after transitioning. Then I give you two sources which says to the contrary. And long-term data also shows that the suicide rates remain elevated. So you haven't refuted anything I've brought you to.
I feel like I gave you that source, which was saying that 72% of a decrease,
And I told you why that source is not good.
in suicide attempts of the enactments of these laws.
And I told you why that source is not good. I gave you the reason. I told you multiple times. You want me to repeat myself?
Sorry, but an increase in suicide attempts by 72% of ages 13 to 17 in the years following the enactments of these laws is not just a reporting of like, well, did you ask their opinion? No, it's a reporting of how many people attempted suicide.
No, it's self-reported, meaning that the prior existing.
So they lied about trying to kill themselves?
They weren't lying about it. I'm just saying they were probably suicidal even before.
So a 72% increase in suicide attempts from 13 to 17 is what? An opinion or a fact?
It was already pre-existing. That's what I'm trying to tell you. That's why online self-samples are done.
Are you saying that before that we just didn't look into people who had pre-existing conditions, and now that
we did, but it makes sense when anti-trans laws are being passed, they do these samples, because then you can write misleading titles like the way that this source was written, and then make a story about it.
Okay, that didn't address what I just said at all, but go off.
No, it completely did.
No, it didn't, but okay.
Mental health
But if you gotta show
conditions
yourself.
and other factors were not taken into account when it comes to the source, which is why it can be taken seriously.
Everything I'm seeing is anti-trans laws cause a spike in suicidality among trans people. That's everything that I'm seeing.
Do you truly believe at this day and age that the only way we can drop down the suicide rates with trans people from 60-70% something lower is by being more acceptance?
I think if you were more accepting of people that are different than you, then it would drop the suicide rates of everybody, like dead ass. I think I think it's so clear that if you're looking into suicide rates of any minority group, the way they are treated in society is pretty correlative.
Canada, Norway, Denmark, all these countries are one of the most liberal, accepting countries in the world. Yet the suicide rates do not change. Why do you think that is?
Don't change at all? Give me evidence of that.
Sure.
Also, America's a pretty liberal place if you think about it, and we're still pretty fucking mean to trans people. From the top down, if I'm gonna be honest. Transgender and non-binary youth report more than 4 times greater
trans identity and suicide attempts and mortality in Denmark, and it gives you the difference between trans people unaliving themselves and regular people, and it's insanely high. And Denmark is literally probably the most accepting societies in the world. If not first, is definitely one of.
Cool. Each category of adult and pure gender identity acceptance is associated with lower odds of a past year suicide attempt, with the strongest associations within each individual category being acceptance from parents and other family members. The TGNB youth who reported gender identity acceptance from at least one adult had 1/3 lower odds of reporting a past year suicide attempt, and acceptance from at least one peer was associated with lower odds of a past year suicide attempt. Peer acceptance was particularly impactful for transgender youth. The relationship between adult and peer acceptance remained significant after controlling for the association of each form, suggesting unique relationships for each on TGNB youth suicide attempts. Acceptance was more impactful for TGNB youth assigned male at birth compared to assigned female birth.
I'm not even arguing that if people just pretend that or act or believe that trans people, that people can become men become women can become men, that the suicide rate will drop. Even though I still believe that it would still remain highly, alarmingly high, but it would drop a bit. But that's not my argument. My
But I'm
argument is
giving
that
you
it's still
evidence after
high.
evidence of times where you have accepting people in your surrounding circle that don't just call you delusional, crazy, and actually give affirmation, and the suicide rates go down drastically. And then you're saying,
Not
well, look at this
drastically. The
liberal
suicide,
country,
not
and then say, well, look
drastically.
at these specific rates.
The suicide rate does go down, but not drastically. It's the same way if I tell somebody
By
that
1/3 with having a peer or a
hang
parent
on,
that's
hang on.
accepting?
It's
1/3?
the same way if I were to tell people that I'm a bird and I really believe I'm a bird, and if people accept it, I would definitely feel good about myself. I'd be like, okay, people believe that I'm really a bird. So the same way with trans people, if they really believe
Okay,
they're a
cool. Do you know
woman
what you
or
would
they're
say that
biologically,
instance that maybe people being
hang on.
nice to you lower your rate of
Just let me finish.
suicidality, whether you believe it to be
Just let me
true or
finish.
not, which is
Let
what
me
we're
finish.
arguing, right?
Just let me finish. Let's be civil.
No, you're yapping about shit, just trying to call trans people
No,
crazy. It doesn't
I'm
make any
trying to.
sense.
I'm
And it's
trying to.
not
I'm
even
trying
the
to get
point
my
you're
point
trying to
across.
make. So I don't know why you're making it.
No, I'm trying to get my point across. See, you don't let me finish, and then you interrupt me, and then you don't understand what I'm trying to
Go
tell
ahead. Hope it ties in, because I'm pretty sure I'll call it delusional at the end. Go for it.
you. Sure. So I'm not even arguing that being that being more nice to the trans people, generally speaking, will make their suicide rate go down. Obviously, well, even although not drastically, but no shit. But the issue is you can't expect people to treat you a certain way. You can't expect people to call you a certain pronoun for you not to unalive yourself. Like you can't expect somebody to call a trans people a certain pronoun for them to not self-terminate 10 minutes later. You can't force people to behave a certain type of way. The same way, if I thought I was a bird and I really wanted to believe, and I really wanted people to believe I was a bird, I would feel better about myself if they called me a bird. Obviously, I will. But if they bullied me, I would feel shit about myself. I would feel shitty about myself. So it's just about having a free society and not letting people dictate the way you behave. So yeah, that's my
Okay,
argument.
duh, bitch. You said the exact same thing you said initially in 5 seconds. You just extended it into 30 seconds. Thank you for wasting everybody's fucking time. That is a dumb ass point, because we're not talking about people who think they're birds, who are crazy and delusional. We're talking about people who have a different view of gender identity than you. People who literally just disagree about the construct of gender and how it differs from sex than you. And your point is delusional.
Okay, so I have
because
a
you're just
question for you.
saying,
Quick
well,
question.
we shouldn't tell them that it's true because they're crazy. That's
Quick
literally
question.
your argument.
Quick question.
Hey, you got your point, you got your time to talk, my turn. Okay, bitch? Shut up. My point specifically is that the whole argument you're trying to make is mute, because the whole point is that if you're less mean to those people, then their suicidality goes down. The entire thing we're arguing, why we're citing study after study after study, is the rate of acceptance to the rate of suicidality. That is the entire point of bringing up acceptance towards trans people and their suicidality, aka affirmation of their gender identity. So whether you replace it with birds or being a transformer or whatever the fuck you want, the through line is that if you are affirming of people who have this dysphoria, then it is going to lower their suicidality. So whether it's just proving my point. The argument is not in this specific point we're making whether trans people are real or not. It's whether affirmation is helpful to trans people.
Yeah, Coco Swan. Yeah, you were
So
strawmanning
stop
my
coping with the
argument.
bird argument. It's
You
stupid.
you strawman my argument. I said that if a society is more accepting, the suicide rate will drop, but not drastically, and all the studies that I've cited suggest that. Secondly, I don't believe that people should. I don't believe that we should enforce people to act a certain type of way so people don't self-terminate themselves. So,
Then don't pretend to care by quoting these mental health studies. Don't pretend to care.
Hang on. If someone existence depends on what I call them, that person is not mentally okay. If their existence depends on the way society calls them a he or a she,
Okay.
they're mentally not okay.
Okay,
They're
just
not
calling
mentally
what
stable.
people committing suicide snowflakes? Is that your
Oh
is that
my
your
God.
good
Can
point?
you calm down? Can you calm down? No, I'm not calling them snowflakes. I'm just saying they're
No,
not
I'm
mentally
gonna
okay.
kill myself. Stop! Stop it, please.
Yeah, that's a trans person. We're not calling them.
Like
their
Jesus,
pronoun.
can you stop coping in this argument by saying, "Well, maybe if you weren't so sensitive." Like that's not the fucking point. The whole point is mass hate from a society towards a vulnerable youth is going to cause an increase in suicidality, and your apathy to that does not make you right. It just makes you ignorant.
You just love strawmanning me. I never said that
you
it's
can't
right.
disprove that. You're not addressing that. You keep running from that point.
I never said it's right or wrong. I didn't make a morality.
But then you understand that when I prove you wrong, you just but I know you're right, but they're sensitive pussies. That's your response. That's not proving me wrong.
You haven't been right this whole debate.
Well, then stop going to, maybe if y'all weren't such pussies, maybe debate what we're debating rather than sidestepping to birds and calling them sensitive. Like, what's your point there? I never called them
sensitive either.
What is your point there?
I just said that they're not mentally stable. It's not calling them sensitive. My point is that the suicide rate not only drastically drop in a more accepting society. Secondly, as a society, we live in a free society. We're a liberal society. We believe in human free will. We believe in human free speech, meaning that somebody else's existence should not be a burden upon others' people's behavior. It should not dictate the speech that people use. I don't care if you want to unalive yourself.
Nobody's arguing that. Nobody's arguing that.
You are.
Who is arguing that you need to be legally required to gender affirm people? Who's legally requiring that? I think in a public work environment maybe, but in general society, no.
No, but you just have when a society is more accepting.
If you want to be called Mark and I call you Tim, there is no law preventing me from being an asshole. It doesn't make me right.
Wait, you just said if a society is more accepting, trans people won't self-terminate, meaning their existence depends on
they're less
the way
likely
other people behave. Right, so meaning you're essentially saying that trans people's existence depends on the way other people behave.
Everyone's existence depends on how other people behave. If you discriminate against a minority group in this country extremely and demonize them extremely, their suicide rates are going to go up, especially if they're
Do you believe trans people? Who do you believe was discriminated harsher, trans people or black people in America?
In America, black people.
Right. I'm willing to bet everything that half of black people do not want to kill themselves. Everything, because you don't have mass suicide.
That's just a dumb argument.
Did you have mass suicide?
Do you not understand the difference when it comes to the mass hate that comes from online?
You know what? You know why you don't have mass suicide rates among black people? Because they were not mentally unstable.
Yes, the answer to your question is yes. Black people have a higher prevalence to depression and anxiety due to hate crimes and bullying based on their race.
Wait, so there's more than half of them want to unalive themselves?
I can give you the exact stat. I think it's 1 in 3.
That's analogous.
I think it's 1 in 3 for unenlivenment.
That's not the argument. The argument is that their mental health and these rates of mental harm are proportional to the societal treatment. So right now there is a massive hate campaign around trans people being groomers, demonic, delusional, that you should legally restrict them from being who they are, and that you should socially shame them for it. And you're acting as if that's going to have just a little effect on their mental health, just a little effect on their suicidality rate. But the thing is, you keep changing the goalposts. I'm just going to start hitting you because you can't control your emotions for some reason. I thought you were really into controlling emotions in this live, but specifically, you're into this idea that one, you keep trying to claim that, oh, well, actually, it is accurate that even in these progressive areas, the suicide rate is the same. So there's no actual benefit to being
I never said
socially
it was the
affirming.
same. I said there was
Which
no
is just a dumb.
drastical
I'm going to
drop.
keep muting you because you keep interrupting. Control your emotions, babe. Come on. Practice what you
I'm
preach.
calm. Just
Practice what you preach.
So I got the sources. I got the percentages.
Yeah, but I just need to call out how he keeps changing his argument from, oh, well, actually, I'm right, you're wrong about the suicide rates, to whether you're right or not, we shouldn't be legally enforced or societally pressured to affirm your identity, which nobody was really arguing. Because I feel like the only affirmation you are forced to do is in the workplace, which you would do for pretty much anybody. Like, if somebody's Mormon, I'm not going to go into work call them delusional, expect to not get fired for it. Like, it's just understanding that you exist in a world with other people.
a Mormon existence doesn't. His existence is not dictated on your behavior. He's not gonna alive himself if you don't call him a Mormon.
Great, that wasn't the point that I just made. So your tangential point doesn't address what I
It
said.
really was. But Kay, I have a. But Kay, is
Thank you for
the
not
suicide
addressing what I said.
is
Can you
the
address what I said?
suicide? No, because there's no point of talking to you because you don't understand what I say. You
Because you're
always
scared of the
strawman me.
logic I'm providing. I don't know why.
I mean, I literally dog
Then
walked you
address
this
it.
entire debate. I
Then
dog
address
walked you
it.
this. Yeah, so you misrepresented me multiple times. I never said that the suicide statistic remains the same in progressive societies. I just said there's no drastic changes because
What
there's
is
something
drastic to you?
like a big drop because
Like
because
what?
the reason why the suicide rates are so high in progressive society is because the fundamental issue is not being dealt with, which is gender dysphoria, and you cutting people dicks off doesn't actually deal with the fundamental issue of their mental state, which is gender dysphoria, and there should be other tactics used, not cutting their genitalia off because that's
Okay. Well,
evidently not
actually, you're just wrong.
beneficial.
Factually, you're wrong. In the DSM-5, gender dysphoria is defined as the extreme mental harm that is caused by the misalignment between your gender and your gender expression. Right.
I mean, I just gave you a source that said there's no long-term benefits
So
to
when you have
transitioning.
affirmation, the amount of gender dysphoria that you have actually reduces, or you could go below the
shit, host.
limit. You could go below the limit to where you wouldn't even classify as a medical classification of gender dysphoria. That's like
Host, no shit,
psychological.
no shit.
Why are you
but the
interrupting
suicide
so
will still remain
much?
high.
Who's emotional now? Jesus.
No, I'm not emotional. I'm just saying that
You just can't stop yourself.
Then
Also,
stop
can I give some?
misrepresenting me.
Can I give the information?
Go for it, Cam.
Yeah, I hope. I just want to make
Suicide
sure
is
you
a
give the
third
information that's analogous to the
No,
suicide rate.
no. Actually, Kate said she was going to speak, so she's going to speak. Go for it.
Suicide is the third leading cause of death for Black/African Americans. For non-Hispanic Black or African Americans reported experiencing major depressive episodes, 74%. As frequently as the total population. In 2024, non-Hispanic Black or African Americans received mental health treatment through prescription medication at a 52% rate compared to the total population. Of the total population. And then that does not include the amount of Black people not diagnosed with depression, major depressive episodes, but are experiencing depression, and that is due to systemic racism. But yeah.
Yeah, and I think his argument specifically was more that like, oh, well, Black people were discriminated against more, so their suicide rate should be higher than trans people, but trans people's suicide rates and like younger ages specifically are higher. But I feel like that's more to the social media wave of
what's the rate?
trans
Also,
people.
what's the rate? Because
I have
It's
the rate
really
in front of me.
high.
Hang on. It says in the United States when you compare suicide rates per capita, white Americans have significantly higher suicide rate than Black Americans. According to recent CDC data, the age-adjusted suicide rate for non-Hispanic white people was about 17.6 per 100,000 people. Where non-Hispanic Black people, it was 9.0
so
per
that's not the
1,000
same type
per
of information
100,000.
that we're.
So so white people are double or are twice more likely to kill themselves than Black people. So what's your point?
That doesn't disprove my point. So you ask for information
does.
about
They
Black people.
analyze themselves
Wait, no,
per
it
capita.
doesn't.
Respond to
Wait,
you.
I'm gonna respond. So when it's talking about per capita, it's talking about in comparison with each other in conjunction. Even with that state per capita, it does not include the information and barriers that Black people go through to get not diagnosed with major depressive episodes, anxiety, and things of that nature, as that is a systemic factor. What we're talking about and what you asked me for is information on Black people and their suicide rates. You did not ask me in comparison to white people. You did not ask me in comparison to Asian people. You asked me Black people's suicide rates, which is what I gave you.
Which white people are double more likely to unalive themselves, or white people being discriminated against?
Wait, that's not how you come to a correlation.
What?
Wait, so that's not how you come to a correlation.
Yo, you're
so white people can be
stupid.
experiencing. That's
Okay,
not
I'm on
stupid.
mute,
You
I'm
just
on
don't
mute,
understand
I'm
how
on mute.
Let her
correlations work.
respond. Jesus.
So when it comes to studies and correlations, that doesn't correlate white people experiencing suicide due to racism, because that's not what that is correlating itself to. It's stating that white people per capita experience or participate in suicide at this rate. For Black people, I am giving you the rate in which Black people as a group, as a race, is experiencing a major depressive episode, and that's not simply suicide. Suicide is a different section or facet. Then, when we're talking about why Black people are experiencing suicide, you go into the details as of what is leading Black people to experience suicide. It talks about the hate crimes. It talks about generational trauma. It talks about racism, and then other factors that play along in their life.
Yeah. Also, I just realized it's 3:37, so I kicked him because fuck that. And he kept cutting you off like crazy, which is crazy. But
I don't know why he brought up white people when he asked me to give the suicide rates of Black people.
yeah, it was really weird because it seemed like a Black people versus transgender people argument, and then it became a Black people versus white people argument.
Which made no sense when he
sound
asked
white,
me.
so I don't know why he was dick riding us so hard, but
Mind you, when he simply, the question he asked me is, the question he asked you was, okay, so are Black people experiencing higher suicide rates? And is suicide basically a leading cause in death when it comes to Black people? Which the answer is yes. You didn't ask me to compare it to white people. You asked me what is the rate within the minority group of Black people.
yeah, for sure. You came with the facts per usual, but my argument specifically when it came to him was he kept moving the goalposts from whether it was factually beneficial to their mental health, which he seemed like he cared about in the beginning, and then completely disregarded when it came to free speech, and then trying to somehow reframe the argument as if he was never making that argument in the beginning, which just seemed extremely bad faith.
I noticed that. Like, he was stating that it isn't a significant difference, but when you ask him what is a significant or drastic difference, he couldn't necessarily give that answer. Yes, it is individuals who are still going to experience depression, anxiety, and things outside of environmental factors, but environmental factors does also play a role in why individuals are experiencing depression and anxiety. And then he was also making it seem as if like those environmental factors only include name calling, when a lot of environmental factors when it comes to bullying also are physical. Like, individuals who are getting bullied isn't just your hair is ugly. It's your hair is ugly and then they're beating you up. It's you look ugly and then I'm gonna shove you in a toilet. Like, it isn't simply you're stupid.
Also, you can't ignore the rise of internet, like the internet targeted bullying. Go on. I'm sorry, but like there's racism specifically on a lot of like Black lives on this live. Look at a trans person's live recently. Like 95% of the comments are literally telling them to like self-unalive, and like the mass amount of hate is insane on trans people online right now, because it's literally just all like socially justified violence and like insane rhetoric. I think it's uniquely insane, especially when a bunch of people are having this freedom to self-discover at the same time where this massive weight of hate is coming towards you as like, because like obviously it's still like obviously hard in like high school scenarios if you're in like a minority situation to find community. How many trans people are in like one high school?
Yes. And that's tough. Also why it's like, of course, the rate of suicide is going to be different between Black people and trans people. But like, even when we look at transgender black people, it's increased because it's different things that you are experiencing in your daily life. It also depends on like your environment. Personally, I've never been bullied for being black because I went to an all black school. Who's gonna bully me for being black? I was bullied for my weight, I was bullied for my hair, but I wasn't bullied for being black because everybody in that school is black. Versus people I know who went to an all white school or predominantly white school, they were bullied for being black. So me and them and our experiences are going to look different, and the reason why we have depression or anxiety is going to look differently. But at the end of the day, once we got out of high school and experienced everyday life and we see massive hate towards black people, we're both going to experience some form of like mental anguish. Well, I don't think that's the word.
Yeah.
That's the word. That's the word. From even the things we see online, even if we didn't physically experience it in our adolescence.
I think you should see the rates of suicidality for black people that are on Twitter versus off, because the amount of racism on Twitter is crazy.
Yes, it's horrible. Like, I had to get off Twitter because, like, when I was on Twitter, it was just certain stuff that would be like, this is mentally taxing. Like, even when I'd be
It
on
really
debate
is.
talk, like, I had to get off debate talk because it's like any little thing you say, oh, she's an N-word, she's this, and then it's also like people are so comfortable saying slurs on the internet and bullying people, cyberbullying people, and cyber stalking people via the internet because they're behind a page. So I wouldn't say it's more common than physical bullying, but it's more normalized than physical bullying in the sense that, like, nobody says anything. Nobody sits there and speaks up. Like, even with the whole situation with Rizzy, I don't know if you've seen that, but like, she being cyberbullied for months, nobody's saying nothing. But now that she's gone, somebody want to say something. It's like, I feel like cyberbullying has been seen as like, oh, you just need to get off the internet, when it is more than just getting off the internet. It is, I'm going through this on the internet, and then in my real life, people are telling me the same things. At some point, that's going to be mentally taxing on people.
Some
Like,
people just can't handle the internet either. Like, I'm sorry, as much as people want to say, like, oh, just block, just scroll. For some people, if you go viral for shit, or if you, like, have certain communities online that don't like you, like, some people can't just, like, escape that, because people can make new numbers, people can make new accounts, people can harass you from all over in comment
that's what
sections.
people don't realize.
It's crazy.
Especially like not having a platform. When people don't have a platform, they don't know the extent people go. Like, for me, I am very like thorough when it comes to me keeping my personal life and my social media life completely separate. I don't even use the same name, boo. So like, it's a little harder for people to find my Instagram, find my family. But I know people who have the same name, their first name is they user, and people went so far to like find this and find that and literally come to their house. People send in, can I say this word? I'm gonna say the police.
I mean, the live
Send
is
the
already
police.
restricted. Go for it. And I'm about to head out
But
anyways.
send the police to their house. So it's like, people will take it far even if you're off the internet. Like, again, even with the Rizzy situation, she got off of the internet and she was still being cyber stalked. She was still being cyber bullied. People were finding her real number and messing with her even when she was offline. So it's like, people don't understand the extent people will go just to bully you, just to be a
I will
horrible
never envy a beautiful woman online, because I know it's crazy. Like, what was it? Like Pokimane, every single like fucking content streamer. It's just like they get so many crazy people, even if they're like the nicest, most wholesome person ever. It's like everybody has like, it's wild.
And then it's
But yeah, also at HD in the comments, I just sorry, say your last thing, and then I'm gonna make like a closing statement and then end out the live.
But I was saying, it's also like multiple different types of crazy people. Cause like, even I get the comments and it be like, why are you a 50-year-old man trying to get my number and calling me beautiful and making comments about my lips in S3X? Like, why are you doing that? And then it's those type of crazy people. And then it's the crazy people who are just like mean for no reason.
Literally.
But yeah, that's it.
Also, sorry, LL, I'm heading out right now. But last thing I want to make, HD making the comment about being nicer to them and all their suicidality will go away, like kind of mocking it. I feel like it's very ironic to make jokes about it when your entire argument is contingent on trans people's mental health. And for somebody who's so apathetic about it, I just think, I don't know. Hold on. I had a point there. Let me find it. There was a point specifically about suicidality. Oh, yeah. The whole point is that you have no solution. Your solution is to call them crazy, send them to therapy to literally just say, well, actually, nuh-uh, because that's worked in history. Like, I'm sorry, but telling people to suppress who they are as a solution has never worked out in the end. Never. It either leads to a very low quality of life to where, sure, they won't kill themselves, but they're in hiding their entire life. And it's just like, it's because whenever you put people in these dire situations, they go into survival mode to where they're not killing themselves because they're scared of dying. It's like, there has to be an understanding of the mentality around that as well. And when you're looking at specific rates of suicidality, your solution for fixing these rates of suicidality is just calling them delusional and crazy, which I think is a weird hill to die on when you're trying to lecture us about suicidality. I really think it's stupid. I think if you're trying to come in here and say, well, we should be doing these things to lower suicidality, and your solution is literally to call them crazy, which even in the definition of in the DSM-5 around gender dysphoria, just worsens gender dysphoria, worsens suicidality, and worsens mental harm, your solution is lackluster for all the information that you're rejecting.
And then it's also like they have no evidence for these things. Like they say, it's like they come to conclusions that are not the conclusion that the scientists are coming to, and then they'll be like, well, it's my opinion. And it's like, dude, you're telling me the scientists gave you that. Let's say the scientists gave you that, and then even in their studies that they quote unquote bring up, the conclusion is still, let's address them as blase, 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 and treat them as what they want to be treated by. And then you're like, no, the scientists are wrong about that part, but they're not wrong about whatever I just tried to say that they said prior to. And then it's also like, even with the girl, she was annoying me because she was saying she wanted to be in medical school. And this is basic information. Like, this is basic information you learn in undergrad about implicit bias, cultural competence. All that is basic stuff. And then she was like, I don't need evidence. It's my opinion. Girl, what research class have you taken? What bio class have you taken? You telling me you want to be an anesthesiologist, but you going based off your opinion?
I mean, it's just sad when people invoke common sense to give shit that ignores any context behind that common sense. Because people are just like, well, it's just common sense. Kids don't know who they are. But most queer people knew that they were queer at young ages. So it's just like, it doesn't make sense when you try to apply it to certain things that people just sometimes do know.
Yes, just like they don't have that argument for straight people. Like
they don't.
They're not like, and then just like she was like, well, I kissed girls in kindergarten. Girl, you wasn't kissing girls in kindergarten because you like girls. You was kissing girls in kindergarten because your mama kissed you and you thought it was a way to show that you are friends, you love somebody. Kids, like, and when I said that in the comments, she ignored it. I was hugging and kissing on trees. Was I sexually attracted to trees? Hell no. I just appreciated the tree being here. Like,
birch, please.
like, what are we talking about?
Literally. There's some fuckable trees, though.
Literally, like, let's use our common sense there. You was kissing
putting the whore in horticulture.
Like I was literally the kid at recess hugging on trees, bro. I'm so serious. I was going up to trees and kissing them. I was making sure they plants and their little area was right. Like I was like, I was like, I love you, tree. I love you, tree. I still be saying that. Like when I have my little plants, I'd be like, I love you, plant. That don't mean I'm sexually attracted to the plant.
Yeah, girl, you wanted to get all over Groot.
Apparently, I'm a Grootist. Like, what are we talking about? Like, and that's why I'm like, and then when I said it in the comments, I was like, so when you kiss your mama, it's because you wanna kiss your mama sexually? No. It's different types of like kisses and forms of affection. I know the difference between me kissing a boy because I like him and me kissing him because he's my friend.
Literally. Okay, I gotta head out because I wanted to watch a show, but I appreciate you coming up 3 times.
Watch Welcome to Dairy. Watch Welcome to Dairy, friend.
I need to. Right now, I'm rewatching Stranger Things to get to the new season of Stranger Things, and then Welcome to Dairy.
I haven't watched Stranger Things since season 2. Should I watch it?
I
They're
personally
like
think it gets
defending
better and
it.
better. I
It
just
get
started
better.
season 3. I think it gets better and better, personally.
Okay, because when I watched season 2, I got bored. I did like season 1. When I
There are
watched season
dips in
2, I didn't
season
like
2.
it.
I understand that. I think season 3 has less dips for sure, though.
Okay, I might start over. Cause my man said he like it. His mama said he like it. His sister telling me to watch it. I'm like, okay, maybe I'm gonna watch it.
Also, I skipped through a little bit of the sappy bits, but that's just me.
But watch Welcome to Derry. It's so good.
I need to. I literally, like, all my coworkers were coming in day after day saying last night was crazy. It was insane.
No, cause the finale. Okay,
It's out? The finale's out?
Yes,
I
they
thought there were
just
only like
finished
5
last
episodes
Sunday.
out. How many are there?
It's 8.
Ooh.
But let me tell
Okay,
you
I'm
something.
definitely
They
gonna watch
packed
it.
them episodes. Like the episodes are like an hour long. They're
Hell yeah.
good. Like each episode get better and better. And like I ain't never had a show like where it was like, okay, I'm on the edge of my seat. Like it brought me back to the days where you know how when back in the day when we used to have to actually watch shows every Sunday, like we had to wait.
Mm-hmm.
Like I'm on the edge of my seat. Like oh my gosh, I can't wait till Sunday. Like I can't wait to see what happens next. And then like the final didn't disappoint. Normally, when I do have shows like that, the finale disappoint me. The finale ate the fuck down.
I'm so
I
ready.
can't wait. I'm ready. I'm ready for season 2 already. Like,
Alright, I gotta head out. Thanks for joining though.
no problem, friend.
Bye, friend.
Bye bye.
Y'all, we love Kay. She's the best around here. Y'all, I have no fucking viewership because I kept saying suicide too much. But you know, I think it's stupid when people pretend to care about suicide and then literally their solution is, but you're crazy though, but you're stupid and fake. Like, I'm like, okay, babe, okay, you really convinced everybody in the live that you care so much about suicide. But yeah, I'm gonna go watch Stranger Things because I'm on the season where Billy is shirtless and hot all season, so that's me. And I'll catch y'all later. Night.
Bye, guys. I love you.